Good afternoon, everyone. This is State Senator Kathy Breen. I'm the Senate Chair of the Appropriations and Financial Affairs Committee, and I welcome you today to our meeting. And I'm going to hit the gavel to start, and then I'm going to ask the members of the Appropriations Committee who are in the room with me to introduce themselves. And if you wouldn't mind, Representative Martin, starting.
Thank you very much, Madam Chair. John Martin, House District 151, and I live in Eagle Lake, and I represent Northwestern Aroostook County.
Hello, Teresa Purse. I represent House District 44, which is the majority of Falmouth.
Good morning. Good afternoon. My name is Eric Jorgensen. I represent House District 41, which is part of Portland.
Good afternoon. I'm Soren Millet. I represent House District 71, which is the towns of Norway, Sweden, Waterford, and West Paris.
Good afternoon. My name is Michelle Dunphy. I represent House District 122, which is Old Town in the Indian Island voting district.
Good afternoon. I'm Dennis Keschel from Belgrade, Maine, and I represent House District 76. That includes Belgrade, Fayette, Mount Vernon, Rome, Vienna, and Wayne.
And again, oh, sorry, Senator Sanborn.
Good afternoon, Linda Sanborn, Senate District 30, Gorham, Scarborough, and Buxton.
Thank you very much. Again, I am State Senator Kathy Breen, 6.5 communities in Cumberland County. I understand that Senator Hamper from Oxford County will be joining us by Zoom later this afternoon. So for folks who are joining, members of the committee who are joining us, would you mind starting Representative Hubble?
Good afternoon, Brian Hubble, House District 135, Bar Harbor, Mount Certain, Lemoyne.
Representative Arata.
Hello, my name is Amy Arata, and I'm the representative from District 65, which includes New Gloucester and part of Poland.
Thank you. And my House co-chair, Representative Gattin.
Thank you. Good afternoon, folks. I'm State Representative Drew Gattin. I'm House Chair of the committee, and I represent part of the city of Westbrook.
Thank you. I'm pretty sure we've got all the committee introduced, present and remote. So while my colleagues in the room now move over to their remote locations in the building, I'm going to just talk a little bit about the agenda we have in front of us before we start our first block of presenters. This is in keeping with the work we've been doing in prior meetings, where we've been asking members of the communities all over the state and various sectors to come and talk with us about how the pandemic is affecting either their business sector, their individual business, their consumers of their business, nonprofit, social service providers, healthcare providers, and the like. So all of this is in service to the idea that the governor has asked us to weigh in on how the $1.25 billion of COVID relief funding will be used in the state of Maine. And last meeting, we heard some suggestions and some commitments already made by the administration from the DAS commissioner. We'll be talking a little bit more about that process at the end of this meeting. But at the beginning, the themes today in terms of who will be joining us, we're going to talk we're going to hear from the members of the Permanent Commission on the status of racial, indigenous, and Maine tribal populations, and hear about the disparate effect that the pandemic and the economic effects of the pandemic have affected different communities across the state. After that, we're going to hear from our friends and colleagues in the K through 12 public education system. Then later after that, we'll hear from our friends and colleagues in Maine's higher ed systems. And then at 3:30, hopefully we'll be on time, we'll be hearing from consumers of services who have, we've heard some providers of certain services across the state, but we're going to be hearing a little bit more from folks who are actually usual users of social services and how those services have been positive or challenging, whatever the case may be under the current situation. I'm just gonna, if you just indulge me, I'm gonna change my screen around a little bit and see if we have, we don't quite have everybody for the 1 o'clock beginning time. So I will ask my co-chair, Representative Gatine, if he has any introductory remarks that he'd like to make.
Am I filler, Senator?
Sorry?
Am I filler, Senator?
Yes, you are.
Oh my gosh, such pressure.
You're never out of words.
Senator Breen and I decided that we would start the meeting a few minutes early this time because our experience has been that it has taken 15 or 20 minutes, as we move people to different rooms and have dealt with some technical challenges. It looks like everything kicked off today pretty smoothly, and we don't need all this additional time that we built in. I don't really have anything to say to introduce today's session. I'm very excited. We have a big agenda. We have a lot of invitees. I know we're going to hear a lot of information on some critically important topics, and I'm just looking forward to the day. So thank you.
Thank you very much. Just, now that he's jinxed the technical stuff, because it's gone well so far, I'm sure we'll have some technical problems later in the day. So just making sure, I'm waiting. Maureen, do you have the spreadsheet with the list of all of the participants in order, perhaps?
I have a spreadsheet I'll give you. I couldn't swear that that is the order that you've landed on.
I was under the impression that Representative Rachel Talbot Ross would be leading the discussion starting at 1, but I may be misinformed. So if there's somebody else here to speak on the topic of the letter and the Permanent Commission on the Status of Racial, Indigenous, and Maine Tribal Populations, could you raise your hand? Let me know.
My name is Daryl Newell. I'm a Passamaquoddy tribal member, and I'm on the commission, newly part of the commission. I'm not scheduled to present. I'm waiting for Rachel and others.
Wonderful. Thank you.
I'm honored to be in your presence, and thank you all for your service.
Well, thank you for joining us. I'm really grateful. Joby, did you want to start, or should we wait for Representative Talbot Ross?
Yeah, thank you, Senator Breen. I just wanted to let you know that there are, I think, a total of 4 of us representing the commission who plan to present. And as far as I can see, it doesn't look like the other 3 have joined yet. So Representative Talbot Ross is one of the presenters.
Okay. Would you like to wait, or would you like to get started?
I would wait because I'm really just introducing them. So.
Sure. Okay. Thank you.
Sure.
Senator, I think we set the expectation with the commission that we'd start at 1 o'clock. So that's probably, again, the fact that we got kicked off so smoothly this morning.
So you can, usually I say we'll talk amongst ourselves, but in this case, it would be that you can just talk to yourself.
Exactly.
While we wait.
I'm good at that.
Sure enough, we're having a little bit of technical difficulty. So our analyst is working on it. If you could stand by. Thank you so much.
Excuse me, Senator Breen, I believe all of our presenters are now here.
Thank you very much. Good morning, good afternoon, Representative Talbot Ross. Can you hear me?
Yes, hi, thank you. Good afternoon.
Good afternoon. We're glad you could join us and we appreciate your persistence.
Thank you.
As you might know, we're about to start the section of our agenda today where we're talking about the disparate impact of the current pandemic on the health and economic well-being of Maine's population. And we have, for that section, you and other members of the Permanent Commission on the Status of Racial, Indigenous, and Maine Tribal Populations. And so I'm hoping that you will, even though you're just getting here, that you're ready to start your remarks.
Yes, thank you very much, Senator Breen and Representative Gatine and distinguished members of the Appropriation Committee. I'm going to turn it over to Joby, who will give some opening remarks, and a number of other speakers will follow. So thank you.
Thank you. Yes, good afternoon, committee members. My name is Joby Thoilo. I'm a senior policy advocate with Maine Equal Justice. I'm also honored to serve as a member of the Permanent Commission on the Status of Racial, Indigenous, and Maine Tribal Populations. On behalf of the Commission, I would like to thank you for this opportunity to present on the disparate impact the COVID-19 pandemic is having on people of color in Maine. Recently established by the legislature, the Permanent Commission is an independent entity with a mission to examine racial disparities across all systems in order to dismantle systemic racism and to specifically work at improving the status and outcomes of historically disadvantaged racial, Indigenous, and tribal populations in the state. Duties of the Commission include data collection and research, public engagement, public education, analysis of public policies, practices, and programs, and the Commission can submit its own legislation. The Commission is empowered by statute to advise and consult with all three branches of state government, and it is in this advisory role that we offer the following presentation. Before we continue, please note that while there are 14 members appointed to the Commission, and while many of us are on this video conference, only 4 of us will be presenting today, culminating with closing remarks from the Commission's chair, Representative Rachel Talbot Ross. So with that, I will turn it over to the next presenter, James Mile.
Hi, everyone. Good afternoon. Thank you, Joby. My name is James Mile. Some of you may know me as a policy analyst for the Maine Center for Economic Policy. I'm grateful to be also a member of the Permanent Commission and really appreciate everyone on the committee taking the time to hear us today. I'm going to present a little bit about some of the data behind what we know so far about the impact of COVID-19 on different communities in Maine, and then also a little bit of information
James, can you hold on one moment? You seem to be frozen. I know one of the ways to deal with the bandwidth problem is to have fewer people up on video. So I'm going to take a little bit of a chair's liberty here and turn the video off on most of our members, or they seem to be doing it themselves, actually.
Hi.
Which I appreciate. All right.
Yeah.
So, James, it sounds like you are back in live time.
Yeah, fingers crossed. I stay back. Okay. So yeah, I'll walk you through some of the things we already know about COVID-19 and its racial impacts. So the biggest thing that we know is that Black and Indigenous African American Mainers are experiencing the biggest disproportionate harm from COVID-19, but other communities of color are also seeing disproportionate impacts as well. These disparities have been steadily growing since the Maine CDC first released the data on race and ethnicity of COVID cases on April 29th. Back at the end of April, we already had a sense that there were some racial disparities evident. Black Mainers make up about 1.5% of the population, but they made up 5% of positive cases at the end of April. And Mainers of color overall made up 9% of the COVID positive population, despite only making up a little over 5% of the overall population. Since those disparities have grown significantly, every week the CDC released new data, and they've started releasing data on a daily basis, and we've consistently seen the disparity has been widening every time new data has been released. So by now we know that, so I told you when the data was first released, about 5% of the positive cases were for Black Mainers. Now that it's up to about 27% of the positive cases. And again, Black and African American Mainers only make up about 1.5% of the state's population. So that's a huge disparity. We know that we know that for people of color in general, so when you include other groups in addition to Black Mainers, they make up about 33% of the positive cases. And again, they only make up about 5.5% of the population in Maine. So although Black folks have the biggest disparity among Maine's COVID cases, it's also there for some other groups as well, especially for Mainers from Asian backgrounds, Hispanic or Latinx Mainers as well. Among folks who identify as Hispanic or Latinx, they make up about 1.7% of the population in Maine, but they make up about 4.4% of positive COVID cases. And while 94% of Maine's population is white, only 2/3 of the positive cases where race is known are white. So those are all different ways of sort of getting at that same problem. Some of you may have seen a recent article in the Portland Press Herald on June 21st that drew on not just the Maine CDC data, but also data that's compiled by a national group called the COVID Tracking Project that compiles data from all the states that are reporting this. And by now, most states are reporting racial and ethnic breakdowns of their positive tests, as well as for deaths. From the COVID Tracking Project, the Portland Press Herald found that Maine had the largest racial disparity among any of the states. So with Black and Indigenous African-American Mainers contracting COVID at 27 times the rate of white Mainers, which is really just worth pausing on and thinking about just how staggering that is. I mean, I in dealing with, and those of us who deal with data on racial disparities can sometimes become attuned and sort of numb, I think, to sometimes the disparities where it's bad enough when we see disparities that show that people of color are sort of twice as likely or 3 times as likely as white Mainers to suffer unequal outcomes, but I've never seen anything yet that's quite this severe as 27 times as large. In the last couple of weeks, the CDC has also started releasing data on hospitalizations and deaths by race and ethnicity. The death data, I would caution against drawing too many conclusions from because we have a relatively small number of people to draw from there. But the hospitalization data also shows some shocking disparities. And Black Mainers are being 8 times as likely to be hospitalized as white Mainers. And again, from my analysis, looking at not as many states report hospitalization rates, but from those states that do, that disparity is the largest of any state that's reporting it as well. So Maine as a state is really falling down, I think, on protecting our communities of color from COVID-19 and from the public health outcomes that come from that, not just from sort of hospitalizations and deaths, but we know that there are a whole number of chronic conditions that people are discovering that are now lingering on, even if people, recover from COVID. There are a lot of things that continue to impact people's health for years afterwards. And obviously, with this being a public health problem and being in the middle of a global pandemic, I think it's important to remember that, we can't tackle COVID-19 in our state if we leave any part of the population behind. And so that's another reason why it's especially important to be tackling what seems to be this sort of nearly uncontrolled spread among certain communities in our state. I wanted to turn a little bit and talk about some of the root causes and some of the ways in which we know that sort of systems and policies that are already in place before the outbreak, how these really contributed to the spread in Maine as they have elsewhere. So some of the biggest involve the access to healthcare that among Mainers of color. We know, for example, that while 12% of white Mainers, about 1 in 8 Mainers with a white background, don't have a regular doctor or other healthcare provider, that number is even larger for people of color. So about 1 in 4 Black Mainers and 1 in 5 Mainers from Hispanic backgrounds or Native Americans say they don't. Both groups say they don't have access to the doctor at the same rate. So we know that people of color are about twice as likely to not have access to a regular doctor, primary care physician or the like. Some of that comes from not having access to health insurance, and so the expense is too high. And obviously lack of access to comprehensive health care sort of has a lot of public health implications. It also means people are less likely to have had some underlying conditions treated, like diabetes, heart disease, or asthma, that could contribute to the spread of COVID. But it also means that folks are less likely to encounter a doctor and have themselves potentially tested for COVID early while we can still trace and contain the disease. More than that, we also, there's been plenty of evidence that some of you may have come across of examples of systemic racism throughout the healthcare system. So even individuals who have access to healthcare can have very different experiences within the system. So Black people and immigrants in particular face well-documented challenges in our healthcare system that can make it hard for them to receive the care they need. So for example, there have been studies that have shown that, even subconsciously, doctors can find themselves discounting the experiences of some of their Black patients, or believing that Black mothers have a higher pain threshold, for example. That's led to some really startling disparities in the larger amounts of Black women who suffer in childbirth, and even the higher rates of maternal mortality for Black women. So those are some examples of how, even when you have access to healthcare, many people in these communities don't receive equal treatment at the hands of the healthcare system. There's some examples of that cited in the document that we sent along to you guys. We also know that racism itself and implicit bias actually has its own health effects. So suffering from racism and having the daily stress of living under many of these systems that are fundamentally unequal can lead to especially mental health effects and other things that negatively affect the health of people of color throughout the state to begin with. So they're often the system of racism itself can lead to put people at higher risk from suffering from further health conditions. In Maine, it's particularly relevant to think about some language and cultural barriers that can make it challenging for some immigrants and other people of color, and makes it harder for them to participate in testing and contact tracing. So those can include very simple things like language barriers. For example, more than 1 in 4 Black Mainers reported having limited English proficiency, as did 1 in 5 Mainers from Asian backgrounds. So obviously, if English isn't your primary language, it can be difficult potentially to follow along with information that's being put out by the CDC and other sources. It also can make it difficult for contact tracers to get in touch with people and to build the relationships that they need. A lot of this depends on having trust with the contact tracers and trust in the government institutions who are trying to give out information. And I think some of the cultural barriers, especially where there are people who of color who have come from countries where government institutions are not very trustworthy, it can make it that can be a barrier, I think, sometimes to people receiving care or seeking out care or information from different sources. So bearing all those things in mind can be one way to bridge those divides and to provide more effective public health information to these communities. We also know that, and this is likely to be a big contributor in Maine, given we know that the high prevalence of a lot of the cases of COVID-19 have occurred among people in frontline occupations, especially in the healthcare industry and among home health workers or nursing home workers. We know that people of color in Maine are much more likely to be working in these frontline and high-risk jobs. These are jobs that don't allow for social distancing, and they often have high amounts of contact with the public. So we know, for example, in Maine that Black workers, women, immigrants are all more likely to be holding some of those jobs. So those include jobs like grocery store workers, people who are working in direct care, people working in food processing. We've already seen outbreaks across the country, and one here in Maine at meatpacking plants. Also folks who work in healthcare, not just the direct healthcare providers, although there are a number of those, but also people who work in healthcare settings, often in supporting roles as well. These frontline workers, unfortunately, even though we talk about them as being essential workers, far too many of them are very low wage work, and they have very low access to benefits like sick days or paid leave. And those are some of the things that would allow them to stay home if they're at high risk. The folks who are working for low wages often have very little savings accrued, so they can't afford to take time off if it's unpaid. And some of these folks are even excluded from the unemployment insurance system and have no income options if they have to stay home or if they lose their job due to the economic shutdown. So some of these folks are finding themselves in the position of, you know, if they're in a business that does shut down, or they need to stay home, they have to go back out to work again as an economic necessity. Where these folks are working, we're worried that a lot of them may lack adequate protections in the workplace. That their employer, because these are typically employees who, as I said, are paid low wages and aren't necessarily valued by their employers in the way that they should be. We're worried that they may be vulnerable to not having access to personal protective equipment or proper safety protocols. And often because of the way that, because of some of the discrimination and racism in the way that these workers have been treated in the past, they often feel unsafe being able to raise these concerns with management as well. We also know that low-income workers are more likely to need to use public transportation or to carpool to get to work, and those obviously increase exposure as well. We know there's evidence of discrimination by individual employers in Maine, as well as unfair treatment in the education system that hold back earnings of people of color, so that even when they attend college, that doesn't necessarily give them the income boost that they want. So that's one of the examples of something that holds down the wages for people of color in Maine. For example, some analysis that I did last year showed that on average, a woman of color in Maine with a college degree only earns very slightly more than a white man with a high school diploma. Lots of these factors come together to hold back the economic prospects for Mainers of color in general in all aspects of their lives. And that can include things like typically experiencing unemployment and poverty at twice the rate of white Mainers. So these all add up to conditions in which people of color in Maine often just have fewer economic resources, less access to some of the kind of backstops that you and I might be able to rely on in terms of being able to work from home, take time off work, or be able to afford the kind of housing that allows people to distance or quarantine safely. Some examples of that include, we know that there have been explicitly and overt racist policies in the past, as well as some individual actions that have left generations of people of color in Maine without access to wealth and without access to the kind of credit that we might take for granted and able to build wealth. So not having access to either of those makes it much more difficult to be able to either start your own business or be able to own your own home. So for example, about 3/4 of white people in Maine own their own home, but that's only true for about 1 in 4 Black Mainers. So they're much more likely to be renting and potentially in precarious housing situations. There are some similar statistics if you look at the amount of income that people are spending on housing. People of color and Black Mainers in particular are much more likely to be in this situation of being overstretched and spending a lot of, having to spend a lot of their meager income on potentially overpriced rental housing. On the business side, we know that some of the federal relief programs, like the Paycheck Protection Program, have potentially served to exacerbate existing economic disparities because of the way they were designed. So a lot of these went through traditional banking routes. The federal government, lent the money out through banks. So people who didn't have relationships with banks were less able to get hold of some of the funds. So the Small Business Administration has sort of admitted that it has had trouble getting hold of getting the money and the help out to different people like that. I've already talked a little bit about the inequities in housing and the inability for people to safely distance themselves. We also know, and folks in other committees have heard about the harm that our policing and incarceration policies have on people of color and lead to people being in more dangerous settings like prisons and jails, which have much higher risks of exposure. One example of that shows that even though Black Mainers only account for just a tiny bit over 1% of all the cannabis users in Maine, they account for 5% of the arrests. So we have some evidence that people are being treated differently for doing very similar things. And we already know that people of color and children of color especially, can both depend on the education system for things like free school meals and places to get adequate nutrition as well as learning. But we also know that our education system, and there have been some prominent examples in the media recently, that our education system doesn't always treat people of color equally as well. So we're also concerned that disruptions to school-based learning could make the achievement gap bigger for people of color as well. So there's a lot there. That's kind of what I ran through for some of both the COVID disparities and then the root causes, some of the data behind the root causes that we're concerned about. I'm going to turn to other folks in my group to look at that. And I believe Ian is going to talk to you about some of the solutions that we're pointing to.
Thank you, Mr. Mile. Hello, Mr. Yaffe.
Great, thank you. Good afternoon, everybody. My name is Ian Yaffe, and I'm the Executive Director of Mano and Mano. We're one of over 60 members of the Maine Immigrants' Rights Coalition. And before I begin, I want to acknowledge the powerful testimonies shared from leaders of Black, African American, Latinx, and Indigenous communities in last week's press conference and in upcoming meetings with Governor Mills. Some of those leaders are here with us right now. Please hear these voices. If you haven't listened to this testimony, please take the time to listen to it today. And finally, as we move into solutions, please take action. Please keep in mind that the system is working as it always has been designed to. We need new tools to treat and recover from this pandemic. COVID-19 disparities that James just talked about are only a symptom of a much broader and deadly disease that has plagued Maine since the compromise that led to its statehood, racism. While we propose addressing COVID-19 specifically with CARES Act funds, we must do so in a way that addresses the root causes of these disparities. Otherwise, this will just be another crisis of many that has defined Maine's 200-year history, a state that has yet to live up to its full promise. When we find solutions that work for Black, Indigenous, and people of color in Maine, we find solutions that work for everybody. But as you can see today, it doesn't work the other way around. This committee also needs to provide emergency support to tribal nations in a way that honors their sovereignty and is on a government-to-government basis. Community-based organizations and leaders from Black, Indigenous, African American, and Latinx communities and other people of color know the solutions needed to support and protect their communities, and they've been working since March. The legislator should direct CARES Act funding to local community-based organizations to respond to urgent needs of Mainers of color who are being harmed and are at greater risk of COVID-19. That response, designed by those who best know their community's needs, should tear down barriers and create new ways for the state government to work with the Mainers that is meant to serve. The legislator has broad authority to define what necessary means under the CARES Act. We need you to send a strong message that it will make investments using CARES Act funding in a way that is proportional to the people who are most directly impacted in Maine. We're talking about over $1 billion here that can be used for prevention, treatment, and recovery. And we need you to send a strong message that investments are urgently needed and are overdue, that we're going to make these investments using new tools that are fundamentally built on relationships and trust with directly impacted communities. These tools must include unrestricted funding and upfront investments instead of the usual ways that the state does business, which contribute to the disparities that we've seen since the crisis began and that we continue to see today. Given the increased financial strain on municipalities to meet the needs of our state's most vulnerable residents through the General Assistance Program, as a result of this public health emergency, especially when it comes to communities of color, we think it's imperative that the state use CARES Act funding to reimburse municipalities for 100% of the expenditures made to recipients above the general assistant maximums, and to remove restrictions that are based on immigration status once and for all. We are all in this together. Finally, the legislator should direct CARES Act funding to support emerging community-based organizations in diverse communities of color that have a severe lack of social infrastructure in place to adequately respond to COVID-19 and any public health crisis. We know that we will be responding to COVID-19 for many months and even years to come, and that existing and new public health threats will disproportionately affect the same communities until we end the disparities caused by systemic racism. And keep in mind, this is a choice. Therefore, it is imperative that we create a robust infrastructure that can adequately rise to the challenge of creating solutions without barriers for any Mainers. In order to ensure adequate resources are targeted where they most needed, additional funds should be allocated to conduct community-led assessments of the assets and needs of African American, Latinx communities, and other communities of color experiencing disparate impact from COVID-19, where there has not been a robust needs assessment completed. This investment is an urgent need to respond to the current crisis and also should include additional state funds to ensure that communities have adequate resources beyond December 31st, 2020. Please don't let this happen again, and please take your action today. I will now turn it over to Ambassador Dana to talk about additional solutions and new tools that will help us treat, heal, and recover from this pandemic. Thank you.
Thank you, Mr. Yaffe, and welcome, Ambassador Dana. Before you begin, I just want to remind everybody who's on the Zoom and folks who are watching remotely that I have deliberately taken the video cameras off of most of my fellow committee members, because we have found that having everybody's face showing live compromises the transmission of the audio. So since we all see each other an awful lot, we decided to focus on the live faces of the folks who are joining us today. So I just want to remind everybody that that's why you're seeing black squares with names in them rather than live attentive faces, is because we want to be able to hear our presenters loudly and clearly. So thank you, Ambassador Dana, for letting me, and the floor is yours.
Thank you, Senator. It's good to see you. Good to see you all. And I serve as a tribal ambassador for the Penobscot Nation. I also serve on this permanent commission. And I really appreciate the work of all my colleagues and these measures that we've been able to develop together, these recommendations. So I appreciate having the floor here to share more solutions, which is very important. Legislators can look at ways every committee can address this crisis and seek opportunities for leaders from the Black and Indigenous African American communities, immigrant communities, Indigenous communities, Latinx communities, Asian communities, and other communities of color to have meaningful decision-making powers to guide the legislative response to this crisis. Black people, Latinx people, and other people of color are the reason we are able to reopen the economy. They are doing the jobs that are most high risk, and we are killing them and putting them at risk of death for themselves and their families every day. Our response to the economic crisis should include an analysis of how those plans will affect these communities and should not move forward without adequate protections in place for these populations. All Mainers need access to comprehensive health care, no matter their immigration status, and we should use state funds to make that happen. We should look at the ways we can reduce health disparities that make people of color more vulnerable to COVID-19 and other public health crises due to pre-existing conditions. All Mainers need access to safe and adequate housing, no matter their income or immigration status. We must create supports to make this happen, including immediately removing immigration-related restrictions to state housing and general assistance. All Maine workers need to have adequate protections from exposure to COVID-19 and access to paid sick days and paid leave so that they can stay home if they are at high risk, get exposed, test positive, or have symptoms. All Maine workers need access to unemployment insurance systems so that they can have access to income in case they cannot work for any reason due to COVID-19. This is a public health emergency. We need to have a way to ensure that poor people impacted receive an emergency infusion within 1 week of making a claim. We should further decrease the number of people who are incarcerated in Maine to reduce the risk of spread and harm from the virus in jails and correctional facilities. This requires looking at the systemic racism and inequities in our entire criminal justice system that result in Black and Brown Mainers experiencing disproportionate harm in that system. A comprehensive plan is needed in the Department of Education to address disparities in our education system going forward and to work to reduce them during any future school shutdowns that result in remote learning. And lastly, all agencies and state government should have a specific focus on reducing disparities for race and ethnicity. Both those disparities related to the COVID-19 pandemic and disparities in all other areas on which the agencies are focused. All agencies must use best practices for hiring that will increase the diversity of our state agencies so that there are more people from the communities most impacted by these disparities having roles throughout the government. Thank you for listening to our testimony today, and I believe I have the honor of turning things over to our chairwoman, Representative Rachel Talbot Ross.
Thank you, Ambassador Dana. Thank you all for being here today. Appreciate this opportunity. Senator Breen, Representative Gatine, and all the distinguished members of the AFA committee. We truly thank you for this unprecedented opportunity to come before you this afternoon. We are humbled and honored to be here. In addition to the presentation and the data that you have received and our suggestions this afternoon, we believe that it is essential to name that racism is a state emergency. Racism has created the inequality in access to healthcare, housing, wealth, education, and employment, all of which undermine health in general. It is time to name racism as the crisis that it is. We are under a dual pandemic, the coronavirus and systemic racism. Maine must admit that racism is a public health emergency. Otherwise, we have no place else to go. Funding from the CARES Act and any other funding that can come from public and private investment should go directly to the Black, Indigenous, and tribal communities, as you have heard quite succinctly today. This money must go directly to these communities and bypass the current system of reliance upon the state that has given us these disparities generation after generation. The current system is broken, and any attempts to reform a broken system will only be Band-Aids when we have gaping wounds. We must abolish the current system and renew a commitment to ensuring all Mainers are healthy and safe and prosperous. Concentrated and sustained action is needed if we are to interrupt the negative outcomes, the racial disparities. Now, today, urgent need today that will be sustained through a better tomorrow. Again, we want to thank you for this opportunity to be with you this afternoon. And we are joined by a number of guests. We have Representative Craig Hickman, Mufalo Chitim, and Kathy Kilrain Del Rio. We are all open to any questions that you might add. And we want to thank not only Kathy Kilrain Del Rio and Mufalo Chitim and Representative Hickman, but the number of community members who are working on this issue each and every day, tirelessly trying to figure out ways in which we can mitigate this virus and become healthy and strong communities once again. Our hearts, this work, the center of any movement going forward rests with their leadership. Thank you.
Thank you very much, Representative Talbot Ross, and to the other folks on the commission who have joined us to speak, as well as to be present with us. I would like now to see if there are any members of the Appropriations Committee who have any questions for any of the presenters or members of the commission. If you do, Representative Gatine, do you have a question?
I can defer to other members if other members have questions first. Senator.
Okay. Other members of the committee have any questions? You could ask me through the chat function. Representative Dunphy.
Thank you, Madam Chair, and thank you to everyone that presented today. This was great information. Representative Ross, thank you for being amazing on this issue. It's much appreciated and needed, and I sincerely appreciate you bringing this forward. I have a statement to make, and then I had a question. I wanted to make a statement. I was happy to see Garrett Stewart on this call. And I wanted to thank you for the work that you've done towards racial justice with the AFL-CIO, and I was delighted to see you were part of the commission. And finally,
my question is for Ambassador Dana, and thank you for being here and also part of the commission. And I was curious what, I know the Penobscot Nation has taken extensive protocols to protect against COVID. And I was wondering if you could share some of that, given that we know the vulnerability of people of race and color with the virus, and how are the protections being received?
Thank you for that question, Representative. It's great to see you. So we've talked about this a lot in the commission when we're forming these recommendations. You know, we want to be inclusive of the tribes. We're also in a slightly different state than other groups, figuratively. So the Penobscot Nation and other tribal nations, I know that we have Passamaquoddy and Mi'kmaq both represented on this call too. So we acted early and very strongly about this pandemic. We haven't had a lot of COVID cases. We've had, I think, 2 or 3 diagnoses, and they're all off-reservation Penobscot people. But we do have large disparities in other areas of health, high blood pressure, diabetes, heart disease, and all these other sort of things. And that is that trickle down of you know, colonization, attempted genocide, continued oppression, and systemic racism. So by the nature of all that, we do have a diminished population that is very vulnerable. So some of the things we did kind of immediately was closing the borders to the reservation. We have large signs saying, if you're not a community member or an employee or providing an essential service, please don't visit. You know, so we've taken very strong stances like that. Right now we have a travel, I don't want to say a travel ban, but a recommendation in place where we're kind of really encouraging tribal members to quarantine upon return. So it's like what the state is doing, but we're very close knit. So we're able to kind of keep an eye on everyone. And it may feel oppressive to some, but we're being super, super vigilant. I think we closed all of our office buildings and schools before the rest of the state. And right now we have a kind of a 3-phase plan to go back, but absolutely no date to start reopening anything in our community. So we've been able to do all of that, advocate for our own CARES Act funding through our relationship with the federal government, because we're truly acting as sovereign nations, I believe. So my input into this commission and into the recommendations that we've drafted is just to please legislators keep supporting tribal sovereignty, because when the tribes are doing well, the whole state benefits. and we're not burdening the state with super high COVID rates or seeing devastation right now, knock on wood, in our community because we've been able to act as sovereigns on this issue. So thank you for that question.
Thank you. Are there any other questions from committee members for our presenters? I see Representative Peirce.
Thank you, Madam Chair. Can you hear me?
Yes.
Thank you. Thank you all for being here. I really appreciate all the information that we've received in our packet and your testimonies. I'm particularly interested in the letter that you sent to the governor where you asked for some specific resources, and then I think subsequently the governor has provided that. And I'd just like to hear a couple things that you'll be doing with that initially. You've outlined it a little bit in the paragraph, but it's exciting to have that have happened. But I also just am sort of interested, where are you headed right now with those resources?
So this is Representative Talbot Ross. Thank you for that question, Representative Peirce. We are very grateful for the $50,000 in which the governor has generously given to the Permanent Commission. We are working currently on a budget that will indicate the need for staffing and organizational development. We are hoping to be able to build a commission modeled after the staffing and size of the Maine Human Rights Commission. We believe that the work that is before us that you've heard about will take a number of different supports in order to get it accomplished. We are truly committed to public engagement and public education. And while we are trying to operate within this current technology, the best way for us to really get that information and engagement with the public is to be in all of the 16 counties of the state. So we are trying to raise both public and private money right now for 3 full-time staff. We need both an executive director and someone who will operate similar to a staff member in OPLA. There's a lot of research and data collection that must be done. So much information is missing. And even the data that we have, I think James would agree, is not great data, not great information. So we really, really, really need an aggressive research and data collection and analysis component to this work. And in addition to being able to hold public hearings and that public engagement, public education. So we are working on the budget, as I said, but that budget will be several $100,000 in order to bring the right financial and human resources in order for us to get our work done. I hope that helps to answer the question.
Absolutely. Thank you. I appreciate having a little bit of a roadmap and look forward to participating. Thanks.
Any other questions from the committee? Representative Jorgensen.
Thank you very much. And I really appreciate all the information that's been provided. Can you talk a little bit about the effects of Medicaid expansion on this population? And I mean, I'm struck by, I think it was Mr. Miles' comments about the access to healthcare and the disparities that exist in terms of people having primary care docs and that sort of thing. And I'm just wondering about whether there are things we can do with the Medicaid expansion that's already been passed to help facilitate reducing some of those disparities.
I can take a shot at answering some of this. The data that I cited is mostly collected before Medicaid expansion in Maine, so it may be slightly different now. I think that's one of the missing data areas that we have right now. And so that may be something that like the Department of Health and Human Services might be able to give us more information on to help us figure out what the take-up rate for people from different communities has been. Research from elsewhere in the country, we're lucky that we have so many states that have done Medicaid expansion, shows that it does disproportionately help and help to level the playing field for people of color. But that would, I think, certainly documenting sort of what those effects have been in Maine, but ensuring that, you know, folks who are eligible are able to sign up and have the information they need to sign up is really important. And then I think also there's a small population that potentially isn't eligible for Medicaid expansion, especially among the immigrant population, for folks who haven't been here long enough to be able to qualify, and we could do more to help those. I know in Kentucky, they've been looking at doing a special outreach effort to the Black community to connect them with healthcare, whether it's Medicaid expansion or healthcare through the exchanges. And that's, something like that could also be worth considering.
Thank you, Mr. Mile.
I think we have, if you don't mind, we have just two other pieces. I think Kathy Kilrain Del Rio can help answer that question as well. And then Senator Breen, if it's okay, before we close at some point, I'd like to just ask Mufalo from the Maine Immigrant Rights Coalition if she'd like to make any comments. That's okay.
Thank you, Representative. Yeah, in addition to what James was saying, I think it's really important to stress that there are, even with expansion, which has done wonderful things for our state as a whole, there are people who are not getting access because of their immigration status. And prior to 2011, Maine used to cover many of those Mainers using state funds. Those are federal restrictions in the Medicaid program, and we could do that again. That's a choice we're making, not to have those individuals have access to health care. And we know that many of them are really struggling. We hear consistently from members of those communities that access that without any access to a primary care physician, they are struggling they know they have untreated conditions that are making them more vulnerable. And even when it comes to something like testing, when you don't have a primary care physician, it makes it more challenging to get tested, even with all of the expanded testing. So I think that is something that's really critical if we want to truly make sure that all Mainers have adequate health care access.
Thank you. Representative Talbot Ross, who was the next person you wanted to comment?
With your approval, I thought it would be helpful to hear directly from the Maine Immigrant Rights Coalition, who we've been working with quite a lot these last couple of weeks. But Mufalo Chittum is here, and I didn't know if she just had any comments that would be helpful for the committee.
Thank you. Go right ahead.
Thank you so much, Representative Talbot Ross, and thank you to the commission, to the committee for being able to listen to us. I think I just wanted to add that for everything that we introduce, it might be social services, it might be an expansion of Medicaid, without education, without outreach to these communities, those efforts go nowhere. So I think as you heard from Ambassador Dana, if you don't educate a community, if the people that are from that community don't do the education, then everything is still there on paper, but it goes nowhere. So the effects of that, lead us to where we are. And I want to say that 14 weeks ago, when we got the first case in Maine, we brought our community together. But we don't have a gate to close, because these communities are the ones that are holding the nursing homes. They're the ones that are holding the retail. They're the ones in the front lines. So they did not shut in. They did not stay home. They have continued to work. But they don't have the ability to stop. The many phone calls that I hear every time in the community, I don't have the luxury to stop. I can't quit. But if I quit, it will take me there are people who still don't have their unemployment. And so word on the street, if you apply for unemployment, you don't get it, tell me how many people will quit. Tell me how many people will stay home. But if they stay home, They don't have money to fall back on. They don't have grandpa who they can fall back on. They can't quit. And I hear many people saying, I can't stop, I can't stop. But also, if they do stop, they have to go behind this line of where they have to wait for 2 weeks or 3 weeks to hear back from anybody from unemployment and tell me that we will be able to stop people from going to work. No, we won't. So we couldn't close that. We couldn't close our house, but we didn't have the ability and can't afford to close it. And so we can introduce any traditional system out there. But if you're introducing it to an untraditional community, it's not going to fit. How much more can we tell? Can we tell you that what you have on paper doesn't fit? This is why we're here 14 weeks ago, 14 weeks later. It's because you're using the same system to serve an untraditional community. It is important to listen, but to hear and to give us the tools to do it. We've done it before. We did it with the expo. We can do it again. Look what's happening. I mean, Ambassador just told you what they are doing. They have that in control. They have their people in control. Give us back the control. Give us back the control. We know our people. We know ourselves. We're experienced. We can do it. Give us the money. Thank you.
Thank you very much. Any questions for our panelists from the committee? Representative Gattin.
Thank you, Senator. And the specific question I had, I think, was primarily asked already by Representative Peirce and answered. You know, one of the things that really caught my attention a couple weeks ago was the original letter that I saw that the commission had written to the governor about possible uses of the CARES Act money to support these populations. And after I saw that, I thought it was very important to be able to have the commission come and talk to us about that. And I'm very grateful that we have that information. And I think today we also got a bunch of additional great ideas and you know, important suggestions about, you know, how we use this money. I feel very strongly as we continue to talk among ourselves and with other legislators and with the governor's office about how the CARES Act money could be allocated, that it's absolutely critical that some of that money be used to address the disparities and the disparate impacts of this crisis. It is, I mean, the numbers are just infuriating, right? I mean, I think we all acknowledge that. And to me, what is, you know, among the most infuriating things is that this was absolutely predictable, absolutely predictable. If someone had said, you know, 1, 2, 3, 4 years ago, there's going to be a big public health emergency, you know, it's going to spread havoc, you know, on healthcare, you know, on health impacts on people and economic impacts, and we could have absolutely predicted, you know, who are the people who would have suffered the most and disproportionately. And then, as was just said by Mafalo, you know, I am absolutely sure that the warning signs were there in the very early days of this pandemic about who are the people who are going to suffer the most. And as someone who's had opportunity to spend a lot of time in the last few years with an elderly parent in a nursing home, I mean, you know, go into a nursing home in the greater Portland area or somewhere in southern Maine and look at where the workforce is. So when you see these terrible outcomes in terms of deaths by elderly people in these congregate care housing, and you know the people who are working, trying to give those folks the care that they need every day, it is absolutely predictable that we're in the situation that we're in today. So, we need to do better going forward. I think we need to do better in this moment. I am absolutely concerned also about the economic recovery of people. Again, we had a terrible recession about 10 years ago in this country. Everybody thought that we had recovered. Well, the fact of the matter was only certain people recovered. Other people didn't recover or hadn't recovered or recovered a lot more slowly. So as we look at things, assets that we have like this CARES money, it's my point of view that we need to make it a priority to use that money as necessary to make sure that we're not in this situation again, both in terms of health impacts and also the economic impacts and the economic recovery. I'm grateful that this commission was created last year, which gave us the opportunity to engage with you today, and very pleased to see all the people who turned out today. I hope this is the first of many conversations that we're going to have, because obviously we have a lot of work ahead of us. So I just want to thank all the participants today for being here and sharing these thoughts with us. Thank you, Senator.
Thank you, Representative Gatine. I want to echo much of what my co-chair said. I am also very mindful of the time. So if we don't have any more questions for our presenters, I'm going to do one final pass to see if anyone has any more questions. I'm not seeing anyone. I'm not seeing any electronic hands up. So I want to say thank you to all of you who joined us today. Those who spoke, those who were here to support others who spoke, and we really appreciate your time and effort getting prepared for today and weighing in on what this committee should be thinking about for this set of funds. So I am going to move on to the next part of our agenda. We do have a good number of folks who have joined us for the next session, next topic, I should say. The topic of K through 12 education and the impact of the current pandemic on funding needs, use of federal assistance provided to date, and potential applications of the COVID Relief Fund. I would ask that everybody who is on the panel, if you wouldn't mind turning on your cameras so we can see all of you. Commissioner Macon, I think Vicki Wallach is here from Maine School Management Association. John Kaczynski, I believe, from Maine Education Association. There are some other folks as well. So I am going to ask the folks who are going to speak to, I think the people, let me just be clear about who we have lined up. I have Commissioner Macon leading us off, and then Vicki Wallach and Steve Bailey, then John Kaczynski and Ken Williams. Those sort of are cluster for K through 12 public education. And then we have some higher ed folks, Chancellor Malloy, President Dagler, President Brennan, Charlie Guillermo, and Jim McClymer, who I believe are faculty representatives, but we will get to them after the K through 12 folks. So just to let the new folks here who are presenting, I just want to clue you into some of our, what we have found helpful in this format, in this new world we're all operating in. We've realized that if all of the Appropriations Committee members turn on their cameras, then we compromise the audio quality and the bandwidth and I don't even know what those words mean, but we can't hear other people very well. So we have developed a practice of turning our cameras off so that we can focus our attention on hearing our presenters. So I think I will continue to ask my fellow members to do that so that we can have the clearest possible reception for our panelists. But I don't want you to be under the mistaken impression that folks aren't present or not listening. I can assure you everybody is present and listening. So with that piece of housekeeping behind us, I would say welcome to Commissioner Macon, and we're interested in hearing from you.
Well, thank you very much. And I'm very grateful for the opportunity to be here this afternoon. I had prepared a presentation, but I thought just in interest of time, I'll make my presentation without the slides and just share with you updates around the impact of the COVID-19 virus on our education system and a few quick updates on how the Department of Education responded. I don't want to be repetitive because I did present something similar to our Ed Committee. So I'll get to the points I think that you're most interested in as quickly as possible, so to make room for questions.
Thank you.
But I did want to mention, it's important to note that ahead of the emergency, we were prepared as a department, as well as any department could be. We had developed a school safety center for the state of Maine in our Office of School and Student Supports. That was a newly developed office. That organization helped school districts across the state to prepare trauma-informed environments for students to learn, and also helped schools to prepare emergency prevention, mitigation, and management plans. They were all in various stages of that, of course, when the COVID-19 hit. As soon as we noted that that this pandemic was coming across the country toward Maine, we set up a COVID-19 website. It's on the Maine DOE main page. You can link right from there. I do urge you, if you haven't seen it, to click in there and check out some of the amazing resources that have been available throughout. We immediately set that up, and once schools, when there was an emergency actually declared and schools had ceased their in-person instruction, and educators were left to really reinvent their practice, and school leaders were forced to make incredibly difficult and courageous decisions, we began daily office hours all day long, every content area, including social, emotional, and mental health and behavioral health sessions with live consultation. They were often attended by hundreds and sometimes, over 1,000 people were tuning in. And we learned that it was across the nation and including Canada because our resources were amazing. And so I'm so proud of that. We were featured in a New York Times article and on PBS NewsHour as an exemplary resource for schools, and they directed others there. So as soon as that state of emergency was declared, we turned our attention to meeting the basic needs of students, the emergency and urgent basic needs. And very quickly, we were able to obtain 28 waivers through the federal school nutrition program that allowed flexibilities for school districts to access higher rates of reimbursement for free meals that were provided, and to have flexibilities such as offering off-site summer meal programs in communities where there was not 50% or higher poverty, which required a waiver, and other similar types of waivers. I believe we still have one that we're waiting for that's outstanding. We have applied for it. We should hear soon. And what that final waiver would allow the summer meals programs to expand. Currently, they're all grandfathered through to the end of the summer, the existing ones, but we may be able to also expand and add additional ones through that waiver. We also turned our attention to our homeless students, our most vulnerable populations of students. And so we reached out directly on a weekly basis to the McKinney-Vento liaisons, and our coordinator at the state level provided ongoing consultation and professional development to them. And we also repurposed some carried forward federal McKinney-Vento funding and created very low barrier, easy and quick to produce emergency micro grants for communities to be able to make immediate steps toward meeting those needs of the homeless children and families. We had child nutrition sites available in every community where there are schools. And we had a lovely interactive map on our COVID webpage where if you were a family, you could click and find the nearest, where you were, you could find the nearest sites. In the month of April alone, we provided 2.1 meals. When I say we, it's really the school districts and schools across our state and those tireless, relentlessly resilient nutrition workers who braved it out through the entire expanse of the remainder of that school year. And also the drivers who delivered lovingly those meals. And so we're really proud of what happened with our state and the school departments, the way they stepped up. The next thing we did within the very first week of that state of emergency is we addressed our connectivity needs. And it's interesting, I was listening to the end of your previous conversation, and I guess as we know and have to acknowledge, a catastrophic situation will always disproportionately harm those who are most vulnerable. And when we realize that the concerning inequity that has been the persistent digital divide in our state, when we recognize that that had blossomed into pretty much a humanitarian crisis with little kids and older kids being completely severed from their peer groups, their educators, their therapeutic milieu and social settings, and their educational trajectories, we knew that we needed to act quickly. So prior to the GEAR funding, the Governor's Emergency Education Relief Fund being available, we worked with DECD and Connect Me, and we worked with local anonymous charitable donors to procure some laptops and some data service, cellular data plans for as many students as we could reach. So we put out our initial survey to all schools during the end of that first week, when people were, of course, I mean, the chips were still up in the air, but we did put it out there because we knew that this was urgent. We began meeting those needs immediately. At the same time, we partnered with Maine Public and Educate Maine to create a television show on Maine Public, and you can see the archive. They're adorable and amazing. The archived examples of lessons that were taught by Maine teachers to grades 3 through 5 every single day for an hour on Maine Public, and that was a really great partnership, and the products of those are available permanently. We also provided remote instruction and learning training and support for educators and for families who were trying to either coach or manage or supervise or somehow support from the very uncomfortable and sudden position of being, relegated as both probably a working from home parent of children who are still trying to continue their educational progress. So our Department of Education staff provided, like I said before, daily office hours. They provided training in remote learning 101, like just the basics, how to set up a Google Classroom, and in much higher level, get engaging students. We also had our Office of School and Student Supports folks supporting mental health, social, emotional, and behavioral health, and training educators in how do you make sense of mandated reporting and recognizing the signs that a child is in danger or isn't thriving when you're in a remote learning environment, and how to make those reports. Those types of additional supports were also offered. And you can, again, check out our website, and many of those trainings and live office hours have been recorded and archived. Special education proved to be one of our greatest concerns. And we actually, as it turns out, even in Washington, D.C., they said IDEA was not built for this. Nothing was built to sustain what we have experienced anyway, as a nation and as a state. However, once again, a vulnerable population who needs the very most from education ended up having the most difficult time accessing quality experiences through a remote learning environment. That said, there were many positive lessons. We have begun working with teletherapy, teleeducation, telemedicine to support the needs of students who need those additional supports. We provided administrators and teachers and families and caregivers with ongoing professional development and support through our special services team, also through daily Zoom sessions. And we're learning that we have a long way to go, is what we've learned. We've learned that we have to make a much better plan going forward when it comes to supporting our most at-risk students. And we know that those families of the most disabled children had to bear a disproportionate burden because while school is very important for social, emotional, academic growth, it also provided some respite for those families, and that was taken away. We secured resources through the CARES Act, and those would include specifically the GEAR funding. That's the Governor's Education Relief Fund. We applied that toward expanding our provision of cellular data service access for students who lived in regions where there is no broadband available, or for whom broadband had been unaffordable and inaccessible within their families and in their homes. After 4 surveys of all the schools in Maine, we discovered that 84% of Maine schools had students who were absolutely disconnected from the internet when they went home. And we met 100% of those needs in early May. By early May, we had met that level. And then as we advertised, we just hit this great bar. We heard from many other schools, and we're now reaching out with a 5th. We have already reached out with a 5th survey, and staff members have been calling individual schools just to check in and say, hey, in case you missed it, here's what we're offering in case you have students who are not connected. We anticipate so far what we've used of the GEAR funding totals 5.8 million of the the 9.2 million that we received. We've expended 5.8 on cellular data contracts for students so that they can be connected to the internet. Those are suspendable. Districts are managing that so they can turn them off if there's not a summer program or a remedial situation that they're engaged in, and they can be transferable. We have a balance in the GEAR fund of 3.4. Actually, it's $3,470,216, and we believe that it will take more than that to fully meet the need of those students who are not connected to the internet at this point when we start back in September. We also received the ESSER funds. In both of these cases, it's important to note that the department staff acted immediately on the day when these resources became available. We sent in our applications within 24 hours, and we were approved within two days in both cases. Our ESSER application featured allocations as required by the actual statute to make allocations to the LEAs, which are our SAUs, our school administrative units, based on the Title I formula. That is very specifically explained in the ESSER statute. And then, so we received it, in fact, as a state, according to our disadvantaged counts. That's how states received it. States then provided it to the LEAs based on their disadvantaged student counts. And then the LEAs are required to consult with and share their funding according to the statute based on the disadvantaged counts in those settings with the local private schools. The total amount that Maine received was $43.7 million. 91% of that was allocated and has been offered out in the form of fairly simple grants that the school districts just need to fill out and send in to us so that we can get them into the system. Many of them have done that. I believe 30 so far have submitted for those funds. Others have not yet submitted for the funds for a variety of reasons. This is one of the most flexible and the longest term usage, I guess the longest shelf life opportunities that we have from the CARES Act. And we have until September of 2022, schools have, until all of us have, until September 2022 to expend or to commit and expend those funds. So it's a more flexible than other opportunities type of fund. So if you're wondering who did and who didn't yet apply, there is possibly a very good reason why people might be waiting to see what's going to be the highest need for them as this situation continues to unfold daily. Of that, remaining, there was roughly, or there will be exactly $3.7 million for statewide efforts. And we have applied for that to be used to support an online learning platform that will be ready on September 7th. It will feature Maine educators teaching Maine curriculum and providing all the materials, downloadable supports and resources, links to the various things, like a robust, exciting, engaging online learning experience for Maine kids. Doesn't require a login. It doesn't require funding. It doesn't additional funding once we get it up and running. It doesn't require site licenses. It is an open access, almost like Khan Academy, only Maine style, with some of our most brilliant and creative educators providing educational experiences for students K through 12, every content area in the form of interdisciplinary, project-based, engaging, authentic learning experiences. So rather than being a last-ditch, off-the-shelf canned curriculum, we're going to provide for our students this more enriched and very Maine-specific experience. My lights just went out. Sorry about that. And so that, again, we plan to have an entire first quarter's worth of material up on that platform by the 7th of September. And then by the end of the first quarter, we'll have the second quarter built. And throughout the year, we will be creating a really wonderful resource for students, for educators who are likely going to be thrust into blended learning experiences and so forth. So that's a big project that we're working on right now. We have, in creating our objectives and our priorities for those federal funds, we brought in stakeholder groups that include our student cabinet, family members and family parent advocacy groups, and our partners at MEA, MSMA, MPA, and the Maine Curriculum Leaders Association, and others. And so these were generated by a large group of really invested stakeholders. We also, with that same group, created a framework for returning to classroom instruction. We recognize, and we have heard actually, that our Economic Recovery Committee has declared that the economy depends upon our schools opening and having in-person instruction as soon as it's possible, safe and practicable. We know that there is no place healthier and safer for students than school settings. We know that many students are languishing for lack of that interaction and supervision and integration with their peers. and we're deeply committed to getting there, but we are going to do it safely, and we're going to do it based on the science and recommendations that we have to work with. We've designed a collaborative process for the Department of Education to partner with schools and school leaders in determining when it would be advisable to resume in-person instruction. Our hope is to hone, we right now are in the works on this still, hone two separate sets of criteria. One would be the outer external health markers, and the other would be the internal capacities of a school district to meet the necessary level of CDC requirements and recommendations. I think you all may have received a checklist of what appears to be an extraordinarily prohibitive, expensive, logistically unmanageable list of potential safeguards. We are hearing that those safeguards are intent. That's the whole laundry list. That's what you would need if you were in a high-risk external environment. You'd have to do all of those things to a high fidelity. We are still honing how high, how many things, and so forth. If you were in a medium risk situation, you would tamp that down some. And if you were in a lower risk, you would have some of the bare, I guess the bare minimum, or the lowest level of those applications of, but nonetheless, it's a daunting list any way you look at it. Even the low risk scenario that we would eventually have developed, and that will be developed again with our MEMA, with CDC, with our epidemiologists, and that is under development still. Remote learning going forward, we know that we're also developing a social emotional learning curriculum that will be open source, K through 12, that should be accessible by everybody also for the start of the upcoming school year, in addition to our academic program that we've provided. In general, the impact of COVID on our education system has included sudden disruption and a complete redesign of our system. It has caused educators and school leaders to have increased, their workload exponentially and for a very sustained period of time. Most emergency situations, as you can imagine, when you're putting it all out there every single day, tend to have a shorter shelf life, and this appears to be churning on into the next school year. We have noticed that there was a tremendous exacerbation of existing inequities, and we intend to never, now that we have seen these in this new light, we can't go back to not having seen the impact of the inequities in our state. Students are going to likely need recovery education, after school programs, remediation, and schools are facing multiple possible scenarios for the fall. There's 4 basic scenarios. One is that everybody's back in person. That's a very idealistic and hopeful vision, but it's not particularly likely. Another scenario would be a hybrid, where teachers are trying to manage their in-person classroom and other children who are maybe not in person due to health risks and other COVID-related factors. They're also looking at the possibility that they start remotely entirely or delay their school year start. And then the worst possible thing, if you should ask me what I would, in terms of the worst outcomes we could see, would be that we start back in, we get everybody back into the classroom, and we have to do another emergency shutdown. That is, that's the piece we would want to avoid, in my opinion, above all else. School needs, we have to meet the CDC guidelines when we know which level of those guidelines will meet which level of risk our communities will be facing in the fall. As you know, the situation is dynamic and changing. And as for CRF, I can give you more specifics, but we have applied for and have received through enough PPE to cover our schools through December through the CRF. That's it so far. We hope to put in additional requests, including the possible need for leased space for schools, additional cleaning supplies, professional development, additional buses, cleaning and additional fuel and maintenance for the additional buses, staffing, by which I mean temporary staffing who would be able to provide, like we will need long-term subs. We'll need additional health staff people who could be trained by nurses to be in each building. There are also needs for additional bus drivers and custodians and food service workers. Speaking of food service, there's a large projected increased cost there because in the best scenario where kids are in the building having their nutrition services provided, they likely won't be gathering in a big cafeteria for a long time. Therefore, we need to stagger lunches. We need to increase refrigeration and heating capacity. We need to schools will need to come up with carts and other means by which meals can be delivered to small groups or classrooms, those types of things. They'll need additional staff. And in the event that we are doing blended learning, we would be having in-house staggered lunches and perhaps delivery or a pickup service being run for those students who aren't in the building. We're also looking at there's the online student registration is something that people have requested in the event that it wasn't safe for students to come in, and it would also just be helpful in every possible way to have all of that online registration taken care of. A possible statewide telehealth contract, and we're looking at perhaps because of the workforce shortages that we're facing, a substitute and a bus driver academy. The bus driver academy would offer a CDL license. We want to partner with DOL, and Laura Fortman is very eager to work with us on that so that we could really shake the whole tree of Maine for anybody who might be interested in becoming a bus driver. And similarly, we'd like to find a way to provide micro-credentials to people who would consider being substitutes or provide other ancillary support for our schools. And that concludes my front-facing part of my presentation. I'm happy to take your questions or elaborate.
Thank you very much, Commissioner. Really appreciate it. And I'm breathless just listening. So hats off to everything you and your department have been doing, and to all the local school folks in every community across Maine. I mean, what an unprecedented time and challenge, and it's really been impressive to see everybody rise as they have. So thank you. Before we take questions, I would like just briefly to move on to the other K through 12 panelists. And those are, I believe, Steve Bailey from Maine School Management, and then John Kaczynski from the MEA. Mr. Bailey?
Yes, good afternoon. Can you hear me okay?
Yes, we can. Thank you.
Okay. So good afternoon, Senator Breen and Representative Gatine and other members of the Appropriations and Finance Committee. Pleased to be here this afternoon on behalf of the Maine School Boards Association, as well as the Maine School Superintendents Association. And with me today also will be Vicki Wallach, and she'll have a few comments to share after I've had a chance to share a few comments with you. First of all, I would like to just echo a lot of what Commissioner Macon has said. This has been an incredible collaboration from the time that we knew that we had to step things into high gear, not knowing what we didn't know, and really trying to figure out how things could be happening. So to make that work, superintendents and boards were very proactive right from the start, with superintendents trying to be out in front as much as possible, working with teams within their school, working with colleagues from districts within their region to be able to create plans to develop remote and distance instruction. Weekly meetings occurred with superintendents within region since March 13th. Bi-weekly meetings with MDOE and other education associations to consider issues, problem solve potential solutions, as well as anticipate next needs. Regional remote school board meetings were held to discuss issues and help consider future plans. DOE participated in weekly Zoom updates with presidents of all 9 superintendent regions. We found superintendents using surveys within their districts to communicate with parents, teachers, and students to see how things were going. Those districts needed to create in a very short time remote and distance learning plans, food preparation and delivery, maintaining jobs, which was a really important aspect of this throughout the entire spring trimester, payment of staff, support for students and families. And this was a huge concern as well, trying to provide some social and emotional support for students and families that typically had many of their connections with important staff members within the schools. There was a tremendous effort too to try to track and enhance student engagement. If instruction returns to remote status, that student engagement was a real factor. Commissioner Macon talked about homeless students, but it was more than just the homeless students. In some cases, it was the students who had more difficulty connecting with the remote learning and the distance learning. And so that is another area where we learned that more effort will be needed to be able to continue to take advantage of the School Safety Center, that department that's been created. We worked very much with John Safier as well as Bear Shea within that particular department to provide emphasis on the social emotional learning supports and connections for students and for families. Concerns that superintendents as well as boards have had as the process of trying to anticipate what the budget was going to be able to be for FY21. The concern initially was, okay, how will we get through FY20? And so districts were very carefully monitoring both expenditures as well as looking to see what they could do to be able to prepare appropriately measured budgets for FY21. To be able to do that, they had a concern also there for before and after school childcare. So this was an additional concern that is being thought of by folks. How can we help restart the economy? How can we restart the opening of school by making sure that we provide supports for families and students before and after school? But the bigger concern was how to execute the plans of the school within the constraints of the budgets. So in some cases, budgets have been trimmed. And by doing that, being concerned for this particular tax year, the concern also then is for FY21 as well as for FY22. And what will the impact on the local taxpayer be to be able to maintain and sustain the needed educational opportunities and community supports for the students within our schools. There have been concerns also by board members to be able to see how we can maintain small class size, because that's been a very important aspect of things as we move forward. But we're hearing too that in order to be able to do that, additional staff will be needed. We have a concern with the availability of staff and who's going to be able to come back to school and be prepared for coming back to school. And will additional staff be needed to be able to provide the educational opportunities for our students? Superintendents have a huge concern about the availability of an appropriate PPE, the personal protective equipment, and what those costs will be, and how much will be needed both for students as well as for staff to be able to safely return to a school setting. There's concern for transportation, not only the extra buses that will be needed, but thinking about the space on the buses and how to get students actually back to school if social distancing is still needed, as well as the monitors on the bus or staff that may be needed to make sure that signs and symptoms of students are being monitored, as well as masks be worn if indeed it's required that students be asked and required to wear masks on the buses. There's concerns for staff, not only the appropriate numbers that we have, but also who can return. who's going to be eligible to return, and what's going to be the availability as well as the training for substitutes should we need them to be able to provide the instructional opportunities for our students. We also have a question that relates to an additional cost that we see because superintendents and school boards want to be doing the right thing. There are many legal questions that need to be asked. And so we've already seen where the legal aspects of their budgets have increased as additional legal help is needed to be able to interpret some of the important rulings and work situations as we move forward into this new adventure. We too have concern with access for remote and distance learning, and all we learned from March to June, basically it just accentuated what we knew, that we had a digital divide, and it became that much more apparent as we moved further into the spring. So this can't be just a fix for this summer, for this fall, that what we knew for this spring. This needs to be a long-term fix. To make sure that this is 100% accessible for all of our students. The less fortunate shouldn't be more disadvantaged because of the situation that was brought up upon them, not of their doing. So another concern, and this is one directly as it relates to GPA and school monies, school funds that come to the districts. We do have a concern with funding as it relates to the student enrollment count. We only count students now based on legislation changes. We only count students October 1st. What will a student count be, and how will it be taken October 1st? And what impact will that have on ED 279s for FY21 or FY22? So that's something that we need to consider, and making sure that the districts do get the appropriate funds needed to be able to carry on those aspects of education. All of these things are being done in a way that we're seeing superintendents and boards, again, being very proactive, trying to be ready for whatever is going to be put forward, anticipating needs, knowing that all will be very costly, also looking out for the imperative safety of students and staff as these plans are made. Also looking forward to identifying what the professional development can be to be able to help all staff learn in a way that can enhance what we learned from March to now, but knowing how we can make this even better than what it's been. So there aren't dollars necessarily attached to what's been talked about as related to the concerns that superintendents and board members have brought forward. They can be put into dollar amounts as we anticipate or as we develop more plans to be able to bring this forward. And with that, I'd like to turn my time over to Vicki Wallach, who will add a few other comments from our two organizations.
Hi, Vicki. I'm going to have you restart your video so we can see you.
Okay, I'm trying. Can you hear me? There I am.
I can see you.
Wonderful, thank you.
Senator Breen, Representative Gantine, and members of the Appropriations Committee. It's so nice to see you even virtually. As Steve mentioned, since we don't know if we're going to reopen in the fall or reopen in some parts of the state and not others, we need to prepare for all scenarios. We should also recognize that in the long term, regardless of the virus, we need to change the way we operate to better support parents, as Steve mentioned, and make sure all children have equal opportunity to learn regardless of their zip code. So looking forward, if we're not supporting families, we're not supporting kids. So I'm going to just tick off a couple of things quickly. We should start with early care and child care. We have an extraordinary model in Waterville in terms of EduCare. And if you haven't been there, you should go see it. But it is a very expensive model. There is also a pilot program in Skowhegan that isn't in one building, but rather it ties childcare, education, healthcare, and other support services together in the community. A bill to replicate that program across the state was actually heard in mid-February, about a month before we closed down. And it talks about looking at how to replicate that community support for kids and families across the state. We need to provide statewide, as it has been mentioned, moving on, statewide reliable connectivity to the internet and free access. In our discussions about connectivity, it's not just the broadband, but it's the cost of the internet. And we need to figure out how to make that happen. The $15 million bond to expand broadband will help, but again, it's the connecting then to the internet and also making sure that there are adequate devices at home. We certainly heard of families that only had one computer in the house. And if you have more than one kid, that's a pretty difficult thing for distance learning. We also have learned that throughout the state, and as mentioned earlier, distance learning was not created equal. We need to learn to do, as mentioned both by the commissioner and Steve, that we need to figure out how to do distance learning better. But I think I want to stop there and say, I think given the scenario that happened where we closed schools down and went to distance learning overnight, people did a terrific job. So this isn't a criticism, but we can learn from what we went through. On another note, we need to understand that even if the pandemic gets under control, not all parents will send their children back to school. I've talked to parents in my community and in Augusta, and there are parents who will not send their kids back if there is any risk at all. And as Steve mentioned, this will affect the October count. And it also says, so what do we do with those children if they're not with us? And if they become homeschool parents? And that too could be a concern. It certainly takes them off the count. Other areas in the field, some have been mentioned. We need common reopening guidelines, which we have worked on, and that the commissioner has mentioned. We need CARES funding. We need professional development for teachers in what likely will be a hybrid learning environment. We need digital equity. I guess I keep saying that, but we don't have it just because we have broadband. Digital equity means a whole lot more in terms of devices, in terms of access. And finally, I want to say we need statewide messaging. If we have to not open schools or only open them part way, this will be a very unpopular decision. And the more we can get support from the legislature and certainly the governor's office in explaining what we're doing, because this will be tough on parents if all of a sudden we say you're going to have to be home half the time to be with your kids. So we really need your help in getting that message across. So I know we're short on time, so I will close there. But thank you for this opportunity. It means a lot.
Thank you very much, Vicki and Steve, both of you, for presenting that perspective. Really appreciate it. Now we are going to move on to the last sort of section of the K through 12 discussion, which is going to be from the MEA. And we have John Kaczynski and Ken Williams. Thank you both, gentlemen. And would you like to start, John? Looks like your mic is ready to go.
Wonderful. Can you hear me okay?
We can, thank you.
Wonderful. Senator Breen, Representative Gattini, and other distinguished members of the Appropriations and Finance Affairs Committee, thank you for allowing us to be here today. I'm John Kaczynski, the Director of Government Relations for the Maine Education Association, and I'm joined today by Ken Williams. Hopefully you can see Ken. Ken is a teacher, a 7th and 8th grade teacher at Nobleboro Central School. He's been a teacher for 36 years. Round of applause perhaps for that. But he also is a trustee for the Maine Public Employees Retirement System. So I presented prepared a presentation that hopefully the committee has in their possession. I'm not going to reiterate some of the points that have already been made. I listened to the commissioner and Maine School Management. First of all, I just want to echo some of their words about the amazing work that took place despite these circumstances, and really want to just reiterate the kind of ongoing collaboration that MEA has had, particularly with the Department of Education on all levels and with Maine School Management, and really want to thank everybody. I think our work together has helped mitigate concerns in the field during this pandemic and has certainly helped in terms of statewide support for educators who are doing their best or did their best despite the circumstances. In my presentation, which should also be included on the website under committee related materials, we are consistently surveying educators in the state to get a sense of how things have been going for them during the pandemic. I included with this a few slides from a survey that we did in May. This survey was about 1,700 educators in the state of Maine, and we asked them how remote learning was going for them. As you can see in the numbers, overwhelmingly, people said the educators were saying it was going very well or somewhat well. 69% felt like it was going well. When asked how it's going for their students, a little bit less at 57%. It's certainly a concern when we see 30% not very well and 11% not well at all in terms of the remote learning experience. Included with the presentation as well a slide that asks the educators, same survey, would you say remote learning is better, worse, or about the same as teaching in the classroom? Not surprisingly, overwhelmingly, teachers in the state prefer classroom instruction. You see here 94% said remote learning is much worse or somewhat worse than classroom instruction. Only 3% said about the same, and within the margin of error said much better or somewhat better. And when we asked, has it gotten better or worse since this started? And again, this survey that was included on slide 4 in the presentation was done in mid-May, and 55% said it had gotten better, which is an encouraging sign. Also, in a different survey in April, we did both a national survey and then a Maine survey, and this Maine survey had 1,300 educators in the state of Maine. When we asked them, have you received any training on distance learning? Again, this survey was done the third week in April. When we asked them, have you received any training on distance learning? Only 34% had received a great deal or some training on distance learning. This is much lower than the national, where we saw 47%. And what's very concerning is in terms of those that received a great deal, only 5% of educators in the state had received any training on distance learning. 66% reported receiving not much or none at all. Just moving to my next slide here. How well did the training prepare you for distance learning? This is slide 6 in the presentation. 10% said very well, 65% said well, 35% said not well. This slide to us tells us that there's a need for more professional development, especially with the assumption that distance learning will remain necessary as we continue to deal with the pandemic and the spread of the virus. And so we need more professional development, and this slide tells us perhaps we need better professional development to make sure teachers are getting what they need. I want to just echo the comments of the commissioner and Maine School Management in terms of equity. We asked, this was again from the April survey, the list of issues that school employees have experienced during the coronavirus pandemic with distance learning. And the very top of the list was students not participating or showing up for distance learning. 82% of the educators identified that as a top priority or a very serious concern. Providing the same level of education to all students was right below that. The complexity of teaching students with disabilities digitally was another concern. Lack of built-in supports and social emotional well-being of students. I think you've heard this from the other presenters, but this is empirical evidence to show this is certainly a concern of educators. And to put a finer point on the equity concerns on slide 8, what you see is we asked educators what class attendance was like. Again, this was mid-April, third week of April. And what we see is a correlation here between the students participating in the remote learning and the free and reduced lunch rates. So it's a pretty complicated slide, but I just want to take a minute to explain it. If you see 74% of the teachers that reported more than 50% class attendance are under 25% free and reduced lunch. So you can see here on this chart a correlation where the higher free and reduced lunch rate, the less likely students are participating in class. It's just empirical evidence to further reiterate the inequity problems of remote learning. So all across the state right now, educators are working with school districts, with parents, with superintendents and administrators on plans to reopen. This is going well in a lot of places. Many superintendents, administrators have been very collaborative and have been reaching out and engaging educators and parents in that discussion. We know innovation, collaboration, and creativity will be key in the development of these plans. That said, we know there are many, many challenges. I'm not going to reiterate all. I'm on slide 10 now of the presentation. I won't reiterate all of these, but I do want to hit a few. Educators are certainly very concerned about their own health and safety and the health and safety in students. We believe the science on the spread of the virus among students and in schools remains unclear. You've heard other presenters talk about the challenges of social distancing and face masks among students if or when we reopen schools, or I should say when we open schools. You've heard a little bit today already about transportation. We're expecting guidelines in July from the National Transportation Association, but this certainly will be a major challenge for schools with the expectation of smaller bus runs and more frequent bus runs, and certainly the need for more bus drivers. We're likely to see restructuring of the typical school day. As the commissioner mentioned, things like the cafeteria probably should not be open in most schools, if not all schools during this time. And then schools, educators, students, and families will need to be agile. And just want to reiterate the work that Vicki said to make sure we're supporting parents and families, especially as we see schools with staggered schedules or maybe moving back to remote learning as necessary due to potential outbreaks in certain communities. I think it's important to note, and that we pick this up on some of the surveys that we have done, that the educators that sometimes have the biggest struggles are those that have their own children at home. And it's obviously not always the case that if you work in a school district, your children may not go to that same school. And so that has certainly posed a challenge for some educators as they're trying to manage their own children at home while also providing remote learning. But the biggest takeaway in terms of the challenges we face will be what the commissioner and Steve have already mentioned about the real significant workforce challenges that we face when we reopen schools. The average age of a teacher in Maine is over 55 years old. We're likely to see an increase in retirements from the teaching profession and other education jobs. I did call MEPERS yesterday to try to get a handle on this number, but I will say anecdotally, we are seeing an increase in retirements. Some educators, if they're in high-risk categories, may require accommodations in order to return to school. We are encouraging educators at this time to begin those conversations with administrators. Some may feel unsafe, just patently unsafe due to their own high-risk conditions or those of other household members. And then certainly some educators are going to have concerns about the challenges of students being able to maintain social distancing or the wearing of masks. And I put in another slide here on slide 13, which is something we aren't thinking about now when the weather's nice, but there's certainly going to be infrastructure challenges for schools, especially as we get closer to winter. Now we're going to need more space for classrooms, as the commissioner mentioned, to spread kids out more, but also proper ventilation systems. There's plenty of schools in the state where we have classrooms that don't have windows. Perhaps the windows don't open. And we know proper ventilation is important in enclosed settings when dealing with coronavirus. The bottom line here for us is really that state funding of schools is critical to our success. All these changes that we've talked about today will cost more money to implement. Smaller class sizes will mean more educators, despite the workforce challenges we're going to have. I heard Steve just mention the PPE, which is going to be critical. PPE in particular is probably going to be even more important for teachers who work hand-on with certain disabled students. We're likely to see hybrid and blended learning models that will cost more money to operate well. As the slide showed earlier, we have concerns about making sure that there's high quality professional development for educators to implement those remote learning plans. And I know the DOE has done a lot of work on that. And I really do need to reiterate that any cuts in state aid will likely not be made up by property tax increases. This latest round of municipal budgets, there was significant belt tightening, rightfully so, among many municipalities and towns and school districts. We saw that mostly through attrition of positions not being filled. And we did see some positions that were slated to be filled canceled. And we did see some layoffs. Scarborough in particular comes to mind as a town where there were significant teacher layoffs. And there was very little appetite for the raising of property taxes in this cycle. I think the good news about the municipal budgets this cycle was the additional state aid that the legislature and the governor added before leaving in March really helped stabilize those municipal budgets to see us through. But I know the state's going to have, we all know there's going to be a revenue shortfall ahead. And any cuts to education are simply not, I don't believe we can count on municipalities making up those differences. And we just talked today about all the additional things, all the additional costs schools are going to need in order to reopen. I think the educators in this state want to get back to classrooms. I think they want to get back to their students and their kids. I think, but more than anything, I think they want to do so safely. Ken, I'm not sure if you have anything to add, but that's my piece of the presentation.
Thanks, John, and thanks to the Appropriation and Financial Affairs Committee for allowing me to be here today. I think everybody has their pulse on, it sounds like just about everything except what we don't know yet. So, I mean, there's a whole lot of people thinking about a whole lot of things. And I think that's very much appreciated at the on the educator side. Two things I will mention. I think there's concern out there among MEA members and educators about how we manage art, music, visual and performing arts, and physical education, given the possibility where students will be not doing regular school, where they're active, they're up, they're out. And so that's just one thing that's on the radar. One thing that surfaced for me as well is students being their own family's daycare providers. And the fact that that could actually have an impact on, I don't want to, it just seems it would have an impact on young women more as opposed to young men, given the circumstances of our culture. I mean, that's just that's a big concern. The daycare situation where families need to depend on their own children to provide daycare. And I think just one more thing personally is just class size is such a huge just item as somebody who tried to do their best work on Zoom. And there's a big difference when you're working with 13 and 14-year-olds if you have 17 bodies on the screen as opposed to 5. And that just has so many ramifications as far as scheduling, as far as access, as far as how you manage those numbers in order to reduce class size. So just as somebody who lived it and breathed it, that's just the big one. So I'll leave it at that. And I'm certainly happy to answer any questions. Thank you very much.
Thank you, Mr. Williams, and Mr. Kaczynski, we appreciate that. So I believe we've heard from the different parties we had invited from the K through 12 public system. And I wonder if there are any questions from committee members, and if so, if you could use your, in the chat function, use your raise your hand function. And if you're in the room with me, you can do the same, except use your actual hand. Looks like Representative Peirce. Go ahead.
Thank you. I had a couple questions and then couple requests. So is it okay if I just forge ahead, or would you want me to move it around a bit?
Sure.
Okay. Forge ahead. First of all, I'd just like to thank everyone who provided this information. I think that it feels, I'm exhausted listening to it. I know you're all exhausted participating in it, but I commend you for the amazing amount of work that was done around the state and your ability to literally turn on a dime in a crisis situation that, unlike a hurricane or something else, isn't going away as quickly as we all want. So thank you for that. Commissioner Makeham, I really appreciate you analyzing and looking at the funding that you've received so far, sharing with us what you did with it and what's left and what you intend to do. And if you did have a slide presentation that we don't have in front of us, if you could email us that. But I really, really appreciate the detail within that. That being said, when you didn't really get to a number when we were talking about the things that need to be done and the use for the CARES money. And I know there have been numbers floated around. So maybe at some point during when you answer some of these questions, you might provide some framework for that. I know it's hard to do, but how reliable will that be and how you kind of came to that decision? When we're thinking about back to school, nothing could be more important to, I think, the well-being of students and kids, not kids, all kids, teachers, administrators, health and safety, of course. It's obviously crazy challenging. I would like to know if any thought has been given, though, to maybe instead of thinking about maybe age groups of kids coming back, like pre-K through 3rd or 5th, full time, those littler kids maybe, and then how we might deal with middle school versus high school and having them back at some time. What is your analysis of how we might be utilizing the outside as long as we can? Safely and with a way to have learning in that. And then one thing that I never hear about is how are we going to utilize testing, contact tracing, isolation going forward? Because in order, as we all realize, in order to be all back together in many, many different scenarios, that's really important. And I see school districts as little units, right, of ability to do that. And the YMCA across the country, I think, did a good job of working with providing childcare for frontline workers and dealing with that. But I never hear anybody even talk about that. And I know it would be a big cost, but it seems like money well spent to me. So I'm sure there are challenges with that. And then just wanted to follow up on our presentations before you guys came on board and commend you for the work that you've done for the online platform, because I think we will be in a lot of remote scenarios. And when you talk about all content areas and working, I think with the humane system and with the community colleges system on this. But as we think about those most vulnerable groups and maybe persons of color, is some of the curriculum that you're designing in there been vetted around that or worked on for that? I'm sure it has, but it just strikes me as an overlap between the two conversations we have around equity and what we teach and why. So, Madam Chair, I appreciate your patience with me. I could go on forever because there's just a lot. But I will say that I think out of all crisis can come great strides forward if we're paying attention to where we need to move to. And I think all the presenters understand and see those challenges, but also see maybe those opportunities. And I think in the end, we're going to be a stronger system for this. And I really commend all the work that's been done. So thank you.
Are there folks from the K through 12 system who want to take a stab at some of those questions?
I could take a shot at some of those. I think taking some in order, yes, we can provide you with the slides. Also, we do have estimated numbers for each of those items that we have been hearing will result in additional costs when we pull everybody back to in-person instruction. I'm happy to send a spreadsheet, but it might be important to hear because some of them are fairly complicated. For example, there's an estimated cost of $151 million that would cover the cost of if we needed to substitute or additional substitute or supplement 20% of the staff members in our schools, and that includes teachers, drivers. That is based on some national estimates of potentially up to 23% of staff members being either unable due to certain health risks or whatever, or unwilling or just not coming in. If it would be $151 million to substitute 20% of school staff in our state between now and the end of December. it would be 300 million if we were to extrapolate that out for the whole year if it continued. But it's such a guess. It's a wild guess, but it's based on something. Another example would be the PPE, the cost of PPE for the entire year and health supplies for nurses' offices would amount to 27 million. That's a pretty definite count. That's based on the number of staff and students in our schools. It was an estimate provided by our school health and nursing consultant, and they're connected with the organizations that provide such. We did request CRF and were granted 11 million, which we think will cover needs through December, which is why, I mean, so then there would be additional needs on top of that for the remainder of the year. Costs for extra buses. If we expanded by only, the original estimate was it appeared that buses would be reduced to 1/6 of their actual capacity. Typically, there are 3 students on each seat across the aisle from one another. And the CDC guidelines were saying in a high-risk environment, you would have 1 student every other row skipping each way. So you're really down to 1/6 of your bus capacity. We couldn't even look at that number. We saw the number. It hurt our eyes. We therefore thought, well, if we had to increase by 20% our bus capacity, just a meager 20%, that would be $55.8 million to increase ridership capacity to bring that number of students in. And this would, unfortunately, and all of these things are somewhat estimates. We don't have a number yet on a telehealth contract, and we do have figures for the cost of professional development to help all educators be prepared for the likely eventual scenario of a blended learning model. The additional cost of classroom space, leased rooms and classrooms, and perhaps portables, although there aren't very many of those, just for the record. There's a real issue with procurement of something like a portable lease, but we estimated $25 million for that, an additional $2 million for cleaning supplies. And so those are the types of things. They're estimates assuming that everybody needs all the same things. And you know what? Not everybody's going to need all the same things. And so this will be always an estimate. Unfortunately, the total estimate right now, with those conservative numbers around just increasing by 20% a couple of things, would come to $327.9 million to open the schools, assuming everybody needed all of these pieces. It's the best answer we can give you right now, and it's not as specific as you need eventually, but we'll be putting in specific enumerated and quantified numbers in our applications for CRF regarding some of these pieces. And we have information coming from MSMA because they're doing real inventory around what the actuals will be. So we're hoping to have those requests in very soon. So that's one question. And I think you did ask about I know if I can go to your first and your last, I have those two memories. The work that the department has done around supporting our Black, Indigenous, and people of color populations in our schools. We recognized that this was a major concern long before the COVID situation. And we, in our Office of School and Student Supports, we specifically created a position in charge of helping schools to up their game with respect to cultural awareness, competency, to encourage schools to do curriculum audits and to examine the makeup of their school staff to see, does that actually reflect in any way the children that are being taught by these folks. And so we recognized immediately that the department itself would be disingenuous if we didn't start with our own work. And so we've all, the leadership team has all engaged in, possibly the whole department by now, because we've been trying to ripple it out, in the Harvard implicit bias test. We've pulled in consultants to help us to identify such things as those critical decision points where a department who's making a big decision, whether about hiring a new staff or policy work that we might be doing, those critical decision points, how do we remind ourselves to stop and remember that there are a lot of other needs to take into account and to take perspectives of other populations. Also, we've developed a set of commitments. They're really specific, and our team is right now working on how we're going to actualize and operationalize those commitments. And we're continuing to collect resources for our schools to encourage them and support them in addressing persistent inequities across the board. And it's built into our curriculum. Yes, it's built into that, to the online learning program heavily.
Thank you, Commissioner. There are a couple of other committee members with their hands up. Representative Hubble and then Representative Jorgensen. If you still have a question, then leave your hand up, please. Go ahead, Representative Hubble.
Thank you, Madam Chair, and thank you all for the presentation. I was just, I wanted to follow up on the question. Let's say we did need to substitute 20% of the staff. Let's say $300 million for the year wasn't a problem. I heard Mr. Kaczynski complain about the increased number of retirements. So where would the workforce come from for that?
Well, that's a very difficult question. We have a critical need for a workforce. We're looking at, in this emergency, are there actions we need to take with respect to, as we're in the middle of right now, by the way, reworking the certification rule, Chapter 115, to make it both more inclusive and representative and accessible to all populations, but also to make it more reflective of the world we're living in right now, where we have a tremendous shortage of people who are willing to do the extremely difficult work that's done in our public education system. So yeah, it's a real problem. Specifically, we're looking at developing substitutes and bus drivers where there are critical shortage situations, but you're also likely talking about classroom teachers and school leaders and district leaders. People are not right now knocking our doors down to try to do that work. And so we're trying to keep a strong focus on encouraging people to go into education. We're trying to make it a respectful, highly professionalized and honored type of profession. And we're committed to increasing teacher salaries and benefits, and we are hoping to address this again by the certification route in order to, we're also looking at targeting recruitment efforts to underrepresented communities to also work in our schools.
Thank you, Commissioner. I think Mr. Kaczynski wanted to briefly address that question.
Very brief. I'll just say, Representative Hubble, it's a great question. And I would say we impact that a little bit because I think the more educators feel safe, the less likely we'll see massive retirements. There was a USA Today printed a poll that said 20% of the teachers are not returning to the classroom. I don't believe the case is going to be that high in Maine. I think it'll be less. I think it really depends on what we do, particularly locally, for educators to feel engaged in the process. And throughout the state, I feel like this is working very well. Bangor, RSU 12, Gorham, those places, teachers are at the table with administrators, parents, trying to sort through how we can do this so everybody feels safe. It's not the case everywhere, certainly. I think we can impact that dramatically by making sure those educators feel safe before the push to reopen schools becomes louder.
Thank you.
So
Oh, Mr. Williams wants to comment on that.
I actually turned retirement age in January, and I'm planning on going back. So I'm not out of the mix yet. So thank you.
Thank you. Representative Jorgensen has a question.
Thanks very much. I really appreciated this presentation. It's been great. And really, John, your slides are fantastic. They're very disturbing, but they're really good. The question I have is about the money that you've come up with, the $327 million. And I wanted to know how that squares with the idea of, I guess, when you think about challenges of having a 3-day on, 2-day off schedule or whatever it might be for certain schools, particularly with elementary school. How do you, does that cost, did the schools provide extra, is this cost inclusive of maybe providing some extra coverage around before and after school stuff? And I just trying to think about how that squares with trying to get the economy started up again with people really not being able to go to work and what that means. Easy.
Yes. So yeah, as you heard Vicki Wallach describe, excuse me, the need for us to partner with our local child care organizations and also to maybe explore some of the flexibilities that will be available, hopefully, for popping up as needed child care facilities that partner with and utilize and share space with our schools. So those types of partnerships are certainly something that we're pursuing across the board. And the additional staff, we looked at a whole lot of costs, and we included additional supervision. That could be additional supervision on the bus to make sure kids aren't jumping into the other seat with one another. It could be additional supervision through a before or after care program, utilizing some of those. So yes, that does take that into consideration. And I realize now that you touched on one of the questions that Representative Peirce also mentioned, that is, have we thought about certain models? For example, there are models, and we have international models and from across the country, models that people are piloting or theorizing might work, and we are making those available to all of our schools. Thus far, the department has refrained from, we don't have the authority to, should we want to, dictate which models and which specific practices districts will use. However, we do know that there are certain of them that would be more supportive of the restarting of our economy. For example, the littlest children, the pre-K through 5 kids, are the ones where people really need to be home if those children don't have another place to go. And one model, and please be clear that I'm not suggesting everybody must do this model, but one model for reducing the number of students in a space would be to serve the younger students in person and have remote learning or blended learning options for the older students. And that would help to meet both needs while allowing the schools to do a careful phase back into the full in-person. So it is one of the models. Outdoor learning is really exciting to us. We just submitted a grant for almost $17 million. Cross your fingers, it's a highly competitive grant process. That's very specific through the CARES Act or through the Education Stabilization Act. And it would be to help our educators engage in coursework so that they could become, excuse me, designers like design thinking, education engineers, essentially, who would develop really exciting, engaging, whole child approaches to remote learning. Should it be necessary again, or should it be something that gets built in as a regular part? Again, we're trying to look where are the opportunities to take lessons that we learned and to let the innovation that was born of desperation recently kind of maybe flourish and help us to change some of our systems permanently for the better. And outdoor education, Representative Peirce, is one of the models that we were really highlighting in that grant. So,
thank you, Commissioner. I don't see any other questions at the moment. Looking to Representative Millett to see if he has any. Not today. Okay. I think that concludes this presentation and Q&A, and I just want to leave you on a hopeful note, which is, as you may know, there are a number of people on this committee who are termed out, and we'll be looking for some meaningful activity that might include School Bus Academy. So, you know, keep that in mind. There's a variety of folks in the room and in other rooms that are mostly the ones who served in the House. If they can serve in the House, they can handle a school bus. So thank you very, very much.
Thank you.
Thank you all, and I'm sure you'll keep in touch. We are going to move very swiftly into the next section of our agenda, and I'm going to ask Representative Gattin to turn on his camera again, and I'm going to introduce Chancellor Malloy to begin the section on University of Maine system. And I just want to alert the folks in the higher ed section who are joining us today that we have found in this format that sometimes we run into capacity problems with hearing the presenters. And one of the ways we alleviate that is to turn off our cameras from the committee. And that gives us better audio capacity. So if you'll probably notice that a number of the committee members have turned off their cameras, and I just want to be very clear that that's only so that we can hear you better, and we are certainly listening carefully and using the materials you sent in advance if you did so. So I'm going to take a quick break and turn it over to Chancellor Malloy and let Representative Gattin host for a moment. Yes, we can hear you.
Okay, thank you. I know I'm joined by Brian Lowe, who you're familiar with, and so I just see he popped up on the screen. So Senator Breen and Representative Gattin and distinguished members of the committee, I am Dan Malloy, the Chancellor of the University of Maine system, closing in on a completed year. I actually did close, or today will be the completion of my 1 year in the job, and oh, what a year it's been. Our guiding principles from the moment I realized back in January that we were likely to be impacted by this virus, we began our planning for what eventually became the pandemic. We knew that we needed to take care of our students and our employees. We needed to do everything within our power to help the state and to make decisions based on science and be transparent about the decisions we made. We closed our campuses before spring break and transitioned to remote instruction and work to protect students, employees, and public health in the oldest state in the nation. We issued $12.8 million in room and board refunds within 2 weeks of closing residence halls. No university in the country returned money more rapidly than we did because we understood our students and their families needed that help. We committed to providing financial security for our employees, their families, and our communities by providing wage and benefit stability through fiscal year 20, including paying students federal and non-federal work-study wages through the spring semester, again, because we knew that their welfare was dependent on those dollars. Prior to March 21st, 22% of our spring courses were 22% of our spring courses were online. In 10 days, we transitioned 210,000 additional credit hours to online, and that is a testament, I believe, to the incredible resilience of our students, our faculty, and our staff. We finished the semester with a retention rate of 98.5% and 4,600 new graduates who will experience an in-person commencement as soon as it is safe to do so. We led the nation by distributing $8.9 million in federal CARES Act student relief within days of receiving these funds, with some students receiving automatic direct payments of as much as $675 under the CARES Act. I think we've forwarded some information for you, but I should say that early in the pandemic, the system entered into an agreement with MEMA so that we could bring our unique resources to bear where they were most needed in coordination with state agencies. Few organizations have done more as we have and had such a positive impact on the state. I know that Sam, in her work, has kept you abreast, and I have conducted ongoing and regular meetings with members of the legislature throughout the pandemic. But I'll point out a few of the things that we were able to accomplish for the people of Maine. The University of Maine produced thousands of gallons of sanitizer and distributed it to more than 100 healthcare organizations and provided technical assistance to help Maine brewers and distillers produce tens of thousands of gallons more. This was during a period of time where the sanitizer could not be easily had on the open market. They also made 4,000 bottles of solution that the Maine National Guard used for fit testing. We made for fit testing N95 masks for frontline workers, and we evaluated sterilization techniques, alternative materials to be used, and designs for masks and PPE for Maine hospitals and manufacturers. The system created, or helped create, and took the lead, I would argue, in creating 200 free wireless hotspots in school and library parking lots so that our students and others could access the Wi-Fi capabilities of those systems. We graduated dozens of in-demand nurses and lab technicians early so that they could get quickly into the workforce and be deployed. Our students also volunteered an incredible number of hours in virus hotspots, including nursing homes and assisting our hospitals and the Maine Veterans Home in Scarborough. We transitioned campus gyms in Portland and Presque Isle into 24 hour, 7-day-a-week shelters for individuals experiencing homelessness, which undoubtedly saved lives and slowed the spread of COVID in those communities. We created through UMaine Cooperative Extension an online directory to link consumers to 450 local farms and seafood producers. Already that directory has had more than 1 million hits, and some small businesses report their best months of sales despite their largest customers, restaurants, being closed or curtailed. And we did so much more. We are especially proud of all of our universities for the unbelievable work that they tendered to the people of Maine. That's part of our calling. That is our mission. To make sure that we are responding to the needs of Maine, not just in building a future workforce, but meeting the day-to-day needs when called upon, and I think we responded. As I said, Ryan Lowe is with me and he can provide further detail, but I do want to touch a few points with respect to the economic impact. We estimate that the financial fallout in fiscal year 20 which is closing now, will be approximately $30 million. This includes $12.8 million for room and board reimbursements previously referenced, and at least $6 million in lost auxiliary revenue from camps, conferences, arts and athletics, and other things that we do on our campuses. And it does not include an estimated $22 million in research-related losses at UMaine, primarily UMaine, due to the redirection and downtime at those facilities. We are grateful for the $8.9 million CARES Act funds that came directly to our universities for institutional expenses. However, I need to point out that these federal dollars do not fully offset our COVID costs. For example, UMaine received $3.8 million through CARES, but issued $7.8 million in room and board refunds alone. As the committee is aware, federal legislation, I should say, has provided several important benefits for workers, including paid leave and generous unemployment. As a public institution, we did not receive tax credits to offset the paid leave provided under Families First that more than 200 of our employees used. we are responsible to pay 50% of the unemployment benefit for the money used by those 300 university employees who were furloughed. And we ended the fiscal year 20 with approximately, obviously not certified, $25 million budget shortfall, the largest variance in our history, and a gap we are closing using CARES funding, reserve transfers, and spending reductions. For the fall, I've conveyed the leaders of all Maine colleges and universities. I attempted to and was successful in getting all of the privates and publics to work collectively on a report with respect to how we might, if we chose to, reopen our institutions. One of the salient points of that work was to quantify the impact on Maine's economy of the private and public institutions in the state. We have a value to the economy of approximately $4.5 billion. And we collectively serve more than 72,000 students and directly employ nearly 15,000 non-student workers and thousands upon thousands of student workers as well. Tomorrow, I will announce the system's plans for reopening this fall in a way that allows for on-campus in-person instruction, as well as hybrid and remote learning options for students and faculty. Testing will be central to our ability to do that safely, and we are pleased to have developed a comprehensive testing strategy in partnership with Jackson Laboratory of Maine and Convenient MD, a supplier in Maine as well. We will also be investing in technology upgrades, PPE, including masks for some of our students and making sure our students use those masks, and employees, modifications to our facilities, adjustments in our class size, and reduced occupancy in our residence halls. This will come with great expense, but the bigger cost will be if we don't meet the state's educational and workforce training needs. At the request of the Governor's Economic Recovery Committee, we have provided fiscal year 21 cost estimates in several expense categories that committees thought may align with allowable uses of the $1.25 billion in CARES funding the state received. A summary of that has been provided to you. In addition to the nearly $30 million in fiscal year 20 losses I previously referenced, our estimate for potential fiscal year 21 costs connected to COVID are approximately $45 million, including $10 million in room and board losses due to reduced occupancy by about 20%, in part to support a potential self-quarantining requirement, $12 million for testing and tracing, $6 million for various technology upgrades to support hybrid delivery, and $3 million for facility modifications and PPE necessary to reopen come September. Some of these costs are budgeted for, including nearly $5 million for various technology upgrades to support hybrid delivery, while some are dependent on resources and the evolution of the virus. We have been very intentional in not passing cost onto our students and their families, despite the budgetary challenges that have been created. On top of the 3% pay increase that we had entered into contractually with our employees, a requirement which we now must honor, even though you have not been in session and perhaps unable to support our request for those dollars in alignment with how the state employees, other state employees have been treated. With that, I'm happy to take questions or answer any questions, or if there are materials that you believe I should be supplying that I haven't, certainly will make note and supply.
Thank you very much, Chancellor. I think we will stick with the format that we've been using today, where we'll hear from all of the panelists from higher ed, and if you wouldn't mind staying tuned, and then we'll take questions from the committee for any of the higher ed institutions. Thank you. Is there something specific you wanted Mr. Lowe to say, or he's just available if needed?
You know, I don't want him to outshine me, and every time I let him talk, he does that.
Yeah, that's
so
a risk. Yeah. Okay. Well, we know he's lurking.
Yeah.
So we will move on then to President Dave Dagler of the Maine Community College System. Thank you.
Thank you. Representative Breen, Senator Breen, Representative Gattin, and the Joint Standing Committee on Financial Affairs. I'm David Dagler, President of the Maine Community College System, and I appreciate time to talk with you. When COVID-19 reached the state of Maine in mid-March, we made a decision, and it was based on our priorities. The first thing we had to do was protect the safety of our faculty, staff, and students. We then turned our attention and continued teaching and learning, and we practiced, as we always have, a high degree of financial prudence. That commitment continues to guide our decisions today. When the pandemic forced us to remote instruction and work from home efforts, our faculty and staff plunged into this massively disruptive situation and emerged with creative, effective, and very innovative solutions. Faculty collaborated across the system and discovered new, effective ways to teach. Administrators freed up research and provided staff and students with new technology tools, such as simulation software. It was an all hands on deck ethos that fueled an intense student support campaign and included calling every student on a regular basis to make sure that they had what they need to continue learning. Now, like the university, our students actually finished this year with a lower dropout rate than in prior years. Out of respect for your limited time today and knowing that I've already reviewed many of our past efforts with you, I'm not going to go into detail here, although I do have a written summary, and I think you have that in front of you, that does offer some of the work that was done this spring. And I really don't want to pass up this opportunity to go on the record and formally thank the employees for their dedication, their innovation, and their responsiveness. It was and it remains inspiring. We kept our employees at work and we kept our students at work. We did not enter into furloughs or layoffs. We did transition responsibilities so that everyone was effective and efficient, and they were focused on student retention. At the same time, we adjusted our workforce training platforms, and particularly those that were focused on the pandemic. So when you adjourned in March and approved $2.5 million for Maine's the Maine Quality Center programs to sustain workforce training, that was an accurate prediction of what was needed and things to come. And within weeks, the Maine Quality Centers stepped up healthcare and occupational programming across the state in online programs. We worked in programs such as medical record technicians, pharmacy technicians, medical lab workers, medical insurance specialists, and the list goes on. Of the 44 online health programs that were launched since that date, over 850 people have enrolled, and 25 of those programs have been fully subscribed. We're also supporting the expansion of COVID test kits with the new swab manufacturing facility up in Pittsfield. In a separate workforce training effort, we partnered with Hospitality Maine and created a badge for people in the hospitality industry. There's a badge for food service workers and there's a badge for lodging workers. And to date, over the course of the last month, over 2,100 people have earned that badge. And the businesses, the restaurants and the hotels and the inns are posting them in their windows so that their customers have confidence that their employees now know how to work safely in this environment. We're currently working with the Department of Health and Human Services and the Greater Portland Council on Governments in a program called Health Ambassador Training. That effort will help keep Maine safe as tourists come up this summer. We'll soon be announcing our plans for this fall, but we will be guided when we announce those plans. They are guided by keeping our faculty, staff, and students safe, continuing teaching and learning, But to do that effectively, we have to keep the faculty and staff safe so that they can continue that work. And we will remain prudent financial stewards of the monies that are entrusted to us. We're on our campuses, we have been working and adopting health safety protocols that align with the governor's executive orders and the guidance from public health officials. Our scheduling will limit the number of faculty and staff on campus at any given time, and we will protect and deliver that essential hands-on instruction that comes with the occupations. We will also step up online, high-quality online programming so that students can continue to learn remotely. At the same time, we will continue our partnerships with the state and local communities and with businesses. Maine's community colleges play a unique and important role in the health and economic well-being of the entire state, and we can't let this pandemic sidetrack those efforts. That work, much of which is new and unexpected, has a significant financial impact. But it's a challenge we're meeting with a long-standing commitment to financial discipline. Maine's community colleges are proud of the track record of having balanced the budgets over all the years I've been with the system and before that. We're also responsive to changing circumstances, but we have a deep respect for how the taxpayer money is spent. Given the impact of COVID-related costs, and the handout that you have with you has a detail of those costs, the trustees of our system recently approved a plan that allows us to balance our budget over 2 years. The current budget allows the colleges to maintain a stable teaching environment so that we can continue to support our students and employees. But there are looming costs, and again, those are detailed in some level in the handout that you have in front of you. There are looming costs, and we're not sure what will happen in a number of arenas, including places like state appropriation. We've looked at several financial scenarios, and in the absence of additional resources, we are left with very few tools other than to consider layoffs or reduced programming. Our deepest commitment is to providing the skills to Maine people. Our workforce, that's roughly 1,600 people who make up our faculty, our adjunct faculty, and our staff, are ready to go hard at work to train more than 27,000 people like we did last year and years before it. That includes degree programs, customized training, credit and non-credit offerings. Maine's community colleges are the most direct, affordable, and effective investment for meaningfully advancing Maine's economy. We have the lowest in tuition and fees in New England. We have generous financial aid offerings. And we offer nearly 300 degree and certificate, we offer nearly 300 degree and certificate options in over 140 occupational fields. 75% of those programs are the only ones of their kind in the entire state. It's critical that we continue to provide those opportunities to Maine people. And with your support, we can. Thank you.
Thank you very much, President Dagler. President Brennan, I believe, is here.
Yes, I am.
Wonderful. If you would give us your presentation, we would appreciate that, and then we'll circle back to the committee for some Q&A.
Sure. Thank you, Senator and members of the committee. I'm pleased to be here. I'm particularly pleased to introduce, joining me, someone that is quite familiar to all of you, a former chairman of this committee, Richard Rosen, who is the Academy's new Vice President for Financial and Institutional Services. And when I'm finished with my presentation, I know Richard would be pleased to respond to all of your questions, including what tradition calls upon a former member of the committee to do when they appear before the committee. So with that having been said, in the history of Maine Maritime Academy, the past few months have been the most disruptive, and the threats to the institution are existential. On March 18, 2020, we held an impromptu socially distanced celebration of the class of 2020 on the main campus lawn. And then that same day, we brought a halt to on-campus instruction and sent all the students home. On March 23, we sent home all non-essential employees. And on March 30th, we commenced online instruction for our students. In my past appearances before you, I've told you we are a focused STEM institution offering very specialized programs of study in engineering, management, science, and transportation that are prescribed by the U.S. Maritime Administration and the United States Coast Guard. And Maine Maritime Academy is unique because we're one of only 6 such institutions in the country. We have an enrollment of 1,000 students, more than 70% of whom are residents of the state, and approximately 60% of them are in a regimental program of study. The very nature of our federally required program of study for the majority of our students is referred to as competency-based demonstration of knowledge, which means that our students must demonstrate their ability in person to perform elements of their training in order to receive the U.S. Coast Guard licenses they pursue. This cannot be done online, and for this reason, Maine Maritime Academy is at a significant disadvantage in meeting the challenges presented by COVID-19. As testament to the rigors of the program requirements and of the Academy's commitment to our students, you may have seen recent press accounts that the Academy has partnered with Puritan Medical Products and Jackson Labs to perform COVID-19 tests on our cadets and the crew of the 500-foot training ship State of Maine, who once cleared through medical testing will move aboard the ship next week for a 6 weeks intensive training evolution. The cost of that alone is more than $750,000. To date, the impacts of COVID-19 upon our FY 2021 budget is 16%. This includes revenue losses of $4.9 million and expenses of $1.7 million for a total fiscal impact to the Academy of $6.6 million. The only CARES Act monies the institution has received is $166,000 via the Maritime Administration. The Academy has administered $438,000 in CARES Act pass-through grants money that went directly to students. The Academy has also received $3.8 million in Paycheck Protection Program monies that the Academy carries on our books as a loan. Thus, the financial impacts of COVID-19 to the Academy thus far is $2.6 million, assuming the PPP loan is ultimately forgiven by the federal government. Overall, the net effect of COVID-19 to the Academy's FY 2021 budget is a 6% loss. And you can see that in more detail in the chart that I've included with my remarks. While we are still developing plans for the upcoming semester that will begin in late August, we anticipate that the cost of operation will be greater as we will have new expenses for acquisition of personal protective equipment for all students, faculty, and staff. And this will likely include COVID testing of personnel and students. We also anticipate fall enrollment declines resulting in revenue losses. And given the elimination of licensed preparatory instruction this summer, we likely will require additional faculty instructional service through the 2021-22 academic year. To sum, the impacts of the COVID-19 pandemic to Maine Maritime pale in comparison to the dollar amounts impacting our much larger colleagues in the public higher education partnership in Maine. But we operate on a much narrower margin, and the impacts upon us are profound and threaten aspects of our existence. We at the Academy, the faculty, staff, and certainly our students are appreciative of your efforts to help us address some of the obstacles we've confronted in the past, but we now face a much different landscape. I'm a realist, however, and I know that there are serious needs that will press upon you, and I simply ask that you give this very unique and iconic institution fair and equitable consideration as you address your spending priorities. That concludes my remarks, and I'd be pleased to respond to questions. Thank you.
Thank you, President Brennan. We appreciate that. I misspoke a little bit earlier because we actually do have 2 more presenters from higher ed, and they are faculty members. So the first one is from the community college system, I believe, Charlie Guillermo. Thank you. And then the second one will be Jim McClymer from the Humane System. So Mr. Guillermo, if you'd like to begin, that would be great.
Hi, yeah, Charlie Guillermo. I am Chair of Culinary Arts and Hospitality at York County Community College. And I'm also President of the Community College Faculty Association, representing the faculty at all 7 campuses. I want to start off by saying that we're very pleased with our relationship with the system office and the college presidents. From the outset of this pandemic and the shutdown, our discussions have been great. They've been very inclusive and working with us to ensure the safety of the employees. We had reached out to them what seems like 5 years ago now, but to discuss how do we reopen safely in the fall. And we have weekly discussions on issues and other items as they arise. We, the faculty, we're ready to get back to teaching those valuable skills the workforce needs. We are really desiring to get back to normal, as I'm sure everyone is, but we also want to place this health and safety of everyone involved as the primary driver of what we do. Right now, we're discussing to put online what can go online, but then there are some areas, such as in mine, culinary arts, where it's very difficult to teach how to work in a professional kitchen without being face to face. So we're developing strategies on how to do that and maintain proper social distancing, wearing masks, and all of the protocols that need to be put in place. We're working with this system to get professionals out to the campuses to meet with the faculty that will be doing in-person classes, and what we can do to do it safely, because all of our teaching environments, the layouts, they're all different, and we really do need that individualized attention. For us, though, we do need support. I mean, we're going to need proper PPE for faculty, staff, and students coming into the buildings. We'll need proper screening as they enter the buildings. We'll need materials to allow for social distancing, putting up plexiglass and all sorts of things like that. And we're also going to need the technology to support the online learning we're going to have to deliver. We do have a lot in place now, but there's always more. I mean, now I'm going into a situation where I am actually going to be filming demos of how to saute, how to break down a beef tenderloin and things like that. And we need the technology and the people who know how to edit those things to get them online so that they're valuable and effective learning tools for the students. And that kind of support coming from the legislature could really mean a lot to what we're able to do and the effectiveness of the learning we're able to deliver. Because as President Dagler said, what we do is important to the workforce of this state. Even prior to this pandemic, the need in my area for trained chefs and hospitality people is tremendous. And I still get calls, even with this shutdown, from people asking, do I know anyone that can come and help them? Because even though there is a shutdown, there are several businesses, the ones that do takeout, that are just flat out as busy as they can be. And we also need to consider, you know, my campus does not have dormitories. There are campuses that do, and I know it's got to be an issue at the university system too, to make sure that those workers are given the PPE they need to operate safely and to make sure that those social environments are as safe as possible. You know, the academic buildings are easier to control who enters and goes because they're there for a specific reason. But if you're living in a dormitory or in a social setting, it's a much looser situation. So resources to address those needs are going to have to be had, and consideration for those essential workers in the cafeterias and whatnot will be vitally important. You know, and I'm just going to summarize real quick. We've had a great working relationship with the community college system and the campuses, and we're working through and we're getting geared up and ready to go as best as we can in this completely bizarre environment we're working in. Thank you.
Thank you so much, Mr. Guillemot. Really appreciate it. Next, we have Jim McClymer from Humane System.
Thank you very much. I'm Jim McClymer. I'm a physics professor at the University of Maine, and I'm the president of AFM, the faculty union for all the campuses within the University of Maine system. I want to thank you all for including me in this important work that we're all doing here. When the pandemic hit in March, the faculty, the staff, and the administration demonstrated skill, determination, commitment, warmth to our students by pivoting from in-person to remote instruction. It's also important to note that our students pivoted from in-person to remote learning. None of us signed up for this. It was challenging. It was all met. It is interesting to think about from my career in teaching. During this time, students needed more support and of different kind that I've ever seen. I teach a capstone course in which students need to make final papers and presentations before they graduate. And literally the night before, I have students freaking out over concerns of doing this work. So I'm doing emails at midnight, helping them through it. And I'm sure that every faculty member will have multiple stories of that kind, of how faculty and staff and all help the students. I've also contacted administration to help with students, and they did not drop the ball. They were able to intervene and help students in ways that a faculty member could not. So I also want to join in just saying thanking for the good partnership we've had with our colleagues throughout the University of Maine system. During these times, good decisions had to be made quickly, and the university had the good sense to include faculty and the union into making these decisions, and we're all better off for this collaboration. While it was nice for the semester to end and students to graduate, complete courses, the work didn't slow. We have many daunting challenges to the opening in the fall. And as the chancellor already mentioned, even with reopening, we never really closed. A lot of critical work kept going at all the different universities to support the state. There are the myriad committees that are occurring throughout the University of Maine system and on each campus. There's formal and informal communication between the university administration, the faculty governance, the union, to all make better ideas towards having a safe, just opening that has quality education at its core. If you're looking at me, you notice my hair is not as dark as it used to be. It takes some time to earn an advanced degree, so we are on the older side of young. Many of our staff colleagues all have similar demographics, and we know that this terrible disease is a risk to all, young and old, but it is extra risk for the older ones, and the ailments that come with age put us at more risk. So we need to work with the university to have a safe environment for all while having a quality education. Of course, every faculty member doesn't agree on everything. There are some faculty who think that we shouldn't be opening, some with many concerns, and it's these questions that help make the university do a better job to prepare for the challenges that lie ahead of us. I have participated and seen some of the activities that is going on through the system, and I'm impressed with the quality of work and the depth of commitment and critical thinking to solve these problems. None of these problems are simple. They're not simply solved. In spite of this, I have some concerns that I'd like to share with the committee. No faculty member, no staff should be forced to put themselves in harm's way to teach physically if they can teach remotely. We're making good progress working with the university on this. We hope we can achieve this goal. We also know that some of our colleagues can't work remotely. Some of these are the lowest paid people. We're hoping that they will at least be given hazard pay for some of the work they do. We know that face masks and PPE and common sense will only work if we use them. I'm really glad the University of Maine system is working so hard on these areas. One of my concerns is that the number of masks may not be adequate. I've never talked for multiple hours with a mask on before. I'm wondering if one mask will work, and we'll be doing this many days in a row. The demands of social distancing and the need to meet students who cannot or should not attend class in person will make teaching effective face-to-face classes extremely difficult. So in order to have safe, quality education, we need resources. It's easy to see, and the chancellor's already mentioned some of the extra costs due to COVID. We're also going to have future costs as we deal with whatever 2020 continues to throw at us. I want you to remember that money is just a means to an end. It's a means to allow the faculty, the staff, the administration to do the work. And essentially far agrees the value of the money is actually given to allow us to do this work. It also, the pandemic reveals some issues that we've talked about in the past, though. The UMS budget is primarily an operating budget trying to do two jobs at once, an operating budget and capital budget. We know on many campuses that our HVAC systems are not adequate. This leads to low quality environments for learning. It leads probably to increased colds and flus. And since those are usually not deadly, we just tolerate the fact that people get sick. With COVID, the inadequacy could have more serious consequences. The university, as the chancellor's mentioned, has made investments into improving HVAC. There's never enough time or money. More needs to be done because ventilation will help save lives. So in closing, I ask that as you deal with all the demands I know that you're facing, that you invest in the people of the University of Maine system. It really wouldn't be right if all the people doing all this hard work are left without a job when this is over. I ask that you invest in the infrastructure so that the students and the people can do our jobs safely and well. Again, thank you for all the efforts you put forward towards this.
Thank you very much, Mr. McClymer. Appreciate you making time today. So now we have a little bit of time. We have one more panel who are waiting. But if we have any questions for any members of our higher ed panels, either the leadership or faculty, this would be the time to raise your hand. Representative Dumpy.
Thank you, Madam Chair. My question is for Chancellor Malloy. And I was wondering if there is any sort of coordinated effort amongst the nation's land-grant universities for additional federal funding relief.
Chancellor Malloy, I think you need to unmute yourself and start over.
My apology. My response to the question is that privates and publics, including land grant institutions, have been extremely active in Washington and reaching out to senators and congresspeople, as well as members of the current administration, and advocating on behalf of higher education. One of the reasons that we felt it was important to put in context the size of the industry in Maine as one of the largest employers in Maine was to have folks realize how important higher education is, not just for the product that we produce, that's graduates in a workforce, but on an ongoing day-to-day basis, how many people we employ. I am hopeful that there'll be additional assistance. We believe that there'll be additional assistance for with respect to research, particularly, and we expect that to happen. We've been in regular contact with our congressional and senatorial colleagues as well.
Thank you.
Representative Millett here in the committee room with me has a question.
Thank you, Madam Chair, and I'm reluctant to ask further questions given the enormity of the information we've received today and the fact that we have an additional panel coming up. I'm struck with the notion that there are two people invisible to us who are here or in the remote audience today that might be extremely helpful to our committee as we work our way forward to try to prioritize and supplement both internal and external requests to the existing biennial budget, namely former Senate Chair of this committee, Richard Rosen, and former DAS Commissioner and Chair of the Consensus Economic Forecasting Commission, Ryan Lowe. And I know they're there, and I just wanted to acknowledge them, Madam Chair, and say if there's an opportunity that their bosses, who happen to be heads of our post-secondary institutions, would make them available to us at some point in the time, months ahead. I would welcome the opportunity to get some input from them, having spent so much time in this room and so much experience in building and balancing budgets. So I'm gonna defer from any further questions today, but just would like to make the point that we have some resources here in the remote audience that I hope we can tap into later on.
That's a great point. And I see President Brennan giving the thumbs up. So I think he'll make Mr. Rosen available. And I think probably we know where to find Mr. Lowe as well. So thank you very much. Are there any other questions for any of our higher ed panelists? I don't see any. Let me just make sure I'm looking at all of the folks. Representative Gatine, is there anything you wanted to add?
Well, of course, there's always something I want to say, but I do realize that we're running a little bit behind schedule now. I just want to say again that, you know, throughout the past 3 months, I think that the level of communication that we've gotten from the higher ed leaders in Maine has been really good, and I just want to acknowledge that. That those conversations have not always just been about what's our financial situation and how much money are we going to need. You know, I think there's been a lot of stepping up in terms of what's gone on in our communities and with our workforce. And I'm, you know, I think about the work that the university system has done with our homeless population, working with the state and communities and social service agencies. I just want to say that I think that the way that our higher ed institutions have stepped up and tried to help out has really made an impression on me. And want to thank you for the information today and let you know how much I appreciate that.
Thank you.
Yeah, it's been really, really impressive. And, you know, as we all know, we're only partway through it. So we look forward to continuing to hear from you and work with you as the school year approaches and you continue to be really impressive organizations that are doing so much for our young people and for our economy across the board. And I just want to mention to Mr. Rosen that don't think this remote setting is getting you off the hook for when you come back to our committee, because we will be expecting a certain traditional tribute, if you will.
Senator Breen, thank you. President Brennan referenced that, and it's a perfect example of another one of those joyful traditions that has become complicated in the COVID world. But rest assured that I will fulfill my obligation and provide Maine-based treats.
Well, I don't know if you heard that in the last, when we wrapped up last time, I suggested that our colleagues who are getting termed out might want to be school bus drivers for our K-12 system. So, you know, you've already been scooped up by the higher ed system, but we thank you for all the good work you're doing, and we look forward to working with you a little bit more in the coming months.
Thank you.
Thank you.
All right, I think we're going to continue to move forward. Thank you all from the higher ed panel. Really appreciate your attendance. So the last panel we have is a group of folks who work with and represent consumers of a lot of our social service programs around the state. And if you recall, in our last meeting, we heard from a number of providers of those services. And we thought it would be important to hear from folks who are direct consumers or work closely with consumers and see how services are going across the state in the pandemic era. So the first one I'm going to introduce, because I think she has a time crunch, is one moment, from Disability Rights Maine, Kim Moody. Kim, go right ahead. Turn off your mute.
Yes, thank you. Sorry about that. Thank you. Thanks for having us here today. And I will be quick. I've sent you a rather lengthy document so that you can refer to it at any time if you wish. But as I said in the letter, the report that I got from the staff was about 28 pages, or it was 28 pages of things that just in June that have concerned them specifically related to COVID. I think it's important that of the 587 new intakes that we have received since March 16th, which is the day that we kind of all ran for the hills, 109 of them were specifically COVID-19 related. So intakes went down it took a little dip at the beginning, but they're back up completely to full level now. And 19% of the calls that we received in the past 15 weeks were specifically related to the effects of the disease on people with disabilities. So again, that 11-page document you have is a simple list of the things that we've seen, but just to point out some that I think are the most scary. You all know, most of them, DD clients are certainly our clients with developmental disabilities that are much greater risk of being exposed to COVID-19 because they live in congregate settings. And many of them have underlying health conditions. So we are watching that and we are concerned about that, as are you, as is everybody. I think this is maybe gone by now, but you should know that many people did not have access to their economic stimulus checks. Either guardians got them or we don't know where they went. But we learned that both through our DD team and through our representative payee investigation work, which is Social Security rep payee investigation work. One of the concerning things is that providers of individuals with developmental disabilities are in a position of restricting visitation, community access, and employment. The grave concern there for us is that our clients are losing more independence and other rights. They see other members of the community still get takeout food, visit state parks, etc., and yet many of them are restricted to their rooms. They watch their staff come and go. They are watching their numbers of infection increase, and they are very concerned, as are we. Our clients' rights, as I think you know, were already quite restricted. So this is a scary time, and we're worried about really stepping backward. People are telling us that people with disabilities, developmental disabilities, are telling us that their staff are not communicating about COVID-19 or about the restrictions that are placed on them by the agencies. So there's a much greater need for information to go to the people that all these monies serve. The battle for people's lives to be person-centered, as we say, has been a very long and arduous one for this clientele, with lots of setbacks along the way. So we want to be very clear and open, as does Speaking Up For Us, about figuring out all the ways that we cannot let this crisis set us back in time. Within both the DD and mental health systems, we at Disability Rights Maine, and there are 40 of us, we're all working. We didn't lose anyone. We were set up to very quickly move and continue to do our jobs. Starting on March 13th, we began to send people with laptops to home offices, and we were set up fully within that first week. So we have not missed a day. And we are sensing across the board a loss of attention to that self-direction that I talked about, a loss of attention by providers to the autonomy of their clients and to the individualization that is required to serve them well. And we really think it could go two ways as this pandemic runs its course. In the first scenario, we really worry that the state will lose control of the disparate parts of the disability system, and that the individual provider agencies will run things all on their own terms. And we believe that will create chaos for our clients. We've worked hard, and I've been here for 32 years to try to have a statewide system that really has checks and balances in it. What we hope is the other scenario, which is that DHHS will take a more tighter control over the system and will much more closely regulate the system for the safety of our clients. To that end, DRM believes that we are offered right now a great opportunity to re-envision the way we offer services to people with intellectual and developmental disabilities. We stand ready to help both DHHS and the providers think about new service definitions and models and ways to creatively fund them. The current payment structure in the DD world does not incentivize individualized supports. People basically have to do what the 3 other people they are teamed with have to do all day long. And there's very little incentive for the providers to change this model because it's funded that way, just as there's very little incentive for the providers to assist people in getting jobs. I believe this is the time to really relook at how we just put all people with disabilities together in big buildings all day long. It's time. It's a very old model. And we can do this now. Many providers have been entirely financially dependent on this model because they bill for that one DSP, a direct support professional, for 3 individuals with disabilities. But those places have been closed. They are reopening, but now I really think now is the time to consider that model. And I believe the state is looking at creative ways to do that. I hope that the provider agencies will do so as well. Maine is, as you know, an employment first state. So employment is supposed to be offered and pursued as the first option for all of our clients, but it is not. Because there's no connection, there's no financial incentive for providers to move people out of these congregate day settings. We can fix these problems though, by changing the waivers, by changing rate structures, by offering providers financial incentives that I mentioned for best practices, creating new service models and definitions, and implementing independent assessments, which is not a popular thing. Some of those day programs, as I mentioned, are opening back up now. So this is a really big concern. We're very worried about the transmission rates of COVID-19 for our clients. And we need to just make sure that the state stays on top of this as the tourist season seems to be happening. And lastly, on the DD world, and I just have a couple more things, that DRM really needs adequate PPE for our advocates and attorneys so that we can see our clients face to face. We've been limping along and we have seen clients 10 feet apart with our little surgical masks on, but I have developed protocols for our staff to get back in the field to see clients, and so we're ready, but we don't have the PPE. We're working on it, but it's very expensive and hard to come by, and we cannot necessarily even use our grant monies to purchase it. So we've put in a request to the state of Maine to assist us with this acquisition. Maybe we can be part of a larger buying group or something, because the N95s are now, well, between $17 and $22 a piece per mask. And those are what my staff need to wear, as well as face shields, as you know. Related to mental health and COVID-19, the mental health system, we have been taking numerous cases in which clients are unable to obtain certain services because of the COVID-19 emergency order. Getting basic needs of people met through the service system right now is incredibly difficult. So it's one case after another. People can obviously do Zoom like this for medication appointments, but it doesn't work to help people get groceries in their refrigerator so they can eat. Case management did that and is beginning to do it again. Also, some service providers are closing or shrinking, and I'm sure you've heard from them, and cutting medication management. So these are pretty dangerous trends. We continue to see a termination of services by community mental health providers without department authorization. This is not a new thing, but it has to be figured out. That requirement for prior authorization by the department for termination of services is in the provider contracts and comes out of the provisions of the consent decree. And we haven't been able to fix that yet, just letting you know. And we also worry about the reluctance of the general hospitals to deal with people in crisis while they're feeling the pressure of the pandemic. We're worried that people will be even more pushed into the criminal justice system. Related to kids, we remain concerned about the lack of access for kids to home and community-based services. That's an old mantra that we've been saying for years. As of June 12th, and this is in your document, 414 kids were waiting for home and community-based treatment under Section 65, 377 for Section 28 non-specialized, and 218 for Section 28 specialized. So that's really bad. And we're thrilled that the Office of Child and Family Services just got a large grant, and we hope that they can address the needs of these really important kids that we can keep from being in the system for the rest of their lives. It is unclear, though, how many youth, what we don't have numbers on, is how many youth that were receiving services prior to COVID-19, home and community-based services, I mean, are continuing to receive those services either via telehealth or in person in some way. We know that kids regress without those services, and so we have been trying to get that information, but it's one of the many difficult things. And of course, there are no easy solutions right now to getting kids into the least restrictive and safest places they should be. We're grateful that the grant came in, the big federal grant came into the state of Maine, because we sure need it to try to address these problems of where do our kids go when they can't be at home. And then lastly, on kids, of course, we worry so much more now about our kids being abused or neglected given the lack of outside contact. And that's just a great worry for us. Typically schools and other service providers were places that abuse or neglect or unmet needs were identified, and kids aren't going anywhere. And then you heard from the Department of Education. We are working closely with the Department of Ed, but talk about no easy answers. We remain available to them, and we let them know that all the time in trying to help figure out best practices for instruction for kids with disabilities. We know that before school ended, many students with disabilities were not provided the services and supports they needed to access distance learning. Some students with disabilities simply cannot benefit from online or remote instruction in any meaningful way. So that, we remains to be seen, because we don't know what's going to happen going forward, but we're on it, and as is the Department of Ed. So, and we're behind them, pushing to make sure that kids with disabilities don't get left behind. I just wanted to mention while I'm here, and I put it in your document, that as a result of all of that above education stuff, there's definitely going to be an increased need for individual and systemic educational advocacy in the next school year and beyond. And I hope you know that the legislature has, at your recommendation, this committee's recommendation, funded DRM, Disability Rights Maine, that's us, as Maine's only legal advocacy service for parents of kids with disabilities and or special needs. And you've done that for many, many years. We took several cuts over the years. We are now down to little tiny cuts, but we are now down to $126,000 a year from the Appropriations Committee, basically from the budget. And that funds one attorney and a little tiny piece of another one. And so that's not a lot. And surprisingly, there still are no federal funds earmarked for educational advocacy. I cannot believe that in all these years, but it's still true. So I would ask right now that you please try to keep that funding for us going forward, because parents are really going to need advocates and lawyers, and schools get them, but parents have to pay for it, except for us. Two more things. We're very concerned about voting. We have received several complaints about inaccessible absentee ballots. We at DRM have had a great relationship for many years with the Secretary of State's office, and so we hope that the accessibility issues can be resolved without litigation, but we're ready to do that if we need to, because we have worked, and Sufu, who's here today, we have worked closely with Sufu for many years and with the Secretary of State's office to make sure that people with disabilities get to the polls. And we have increased rates of voting by people with disabilities so much over the years. And this year, it could really be a serious cutback, because blind people can't access an absentee ballot. We don't know if the machines are going to be out. There's just all kinds of issues and questions and problems. And we applaud the work that's being done about that. And we're here to do more if we need to. And lastly, you didn't ask about deaf services, but I wanted to let you know that there's a lot of deaf people in Maine, and we serve them. And we continue to get calls from deaf adults who are struggling to navigate this all remote public services. It's everything is English-based, and they don't speak English. They speak ASL, or use ASL, and it's a different language. So the increased reliance on telehealth services has caused a lot of problems. Doctors' offices are confused about how to schedule and integrate interpreters with video platforms, and so people are having lots of increased problems. DRM put together and hosted something called the Deaf Rights Group. And we've had 3 meetings in June, remote meetings around the state, inviting people from around the state, and they've shared their concerns that really there are many, many barriers to access. So I wanted to just let you know that. And lastly, our deaf-blind clients, I think, face the steepest access barriers in this socially distanced world. Our deaf-blind program is adjusting in response, and we are researching program needs for PPE and modifications. And when those are people that we can't just sign to, we have to touch. So again, I return to the PPE issue. I don't know if there's anything that you guys can do to help access more PPE for those of us who have to be on the front lines, but it would be helpful if you could. And I apologize for talking so fast, but I'm glad to be here and glad for you to be able to move on to my peers who are also with us. Thank you very much.
Thank you very much, Kim. I think we'll hold questions like we have in the past till all the panelists have spoken. And in case you didn't hear it earlier, we have learned that having everybody in the Zoom room be on camera causes some problems with audio quality. So you'll notice that most of our committee members are not using their cameras. And that is because we want to make sure that the audio quality is as good as possible. So I just want to make that comment again so that you understand that folks are listening intently. We all have our materials in front of us, and we are making room in the broadband, in the world of fiber capacity for the folks who are presenting. So thank you for your understanding on that. Next, we're going to have Jenna Maynard talking from the perspective of NAMI.
Great. So I usually use my laptop and I'm at a desktop to make sure it works. Can you hear me fine, or do I need to move closer?
Yes, we can hear you very well. Thank you.
Okay, great. So I know I sent in a document earlier, and I don't want to kind of go over that. I want to talk about two populations. Obviously, NAMI serves a whole host of folks, and really our mission is to advocate, provide support, education, and advocacy to anybody impacted by mental health conditions. I want to talk what I think is a unique perspective we can bring are both about youth and then the intersection of the criminal justice system and crisis mental health services, since we implement the CIT program for the entire state. So NAMI Maine provides the Family Respite Program. It's the program for kids who have 2 or more developmental delays or a mental health diagnosis. We have over 900 families enrolled in the program. We worked really well with OCFS. They were very lovely to keep the program going from, did not miss a beat. We transferred a little bit or narrowed our scope in terms of we were no longer having providers travel from Cumberland County to Androscoggin County, but many providers were, seeing those, working with those families, which they can provide services to for up to 16 hours a month. The state did allow that to change to 26 hours a month as a response to COVID. And we were able to expedite our application process for families or for respite providers. Respite is not a therapeutic service. It's a planned intentional break for parents who are raising kids with special needs. And so what we saw through the respite program, where every other support leaving kids' lives, no more in-home services, kids who I have a child with autism when he was younger, had, an OT, a speech therapist, a school guidance counselor, a private therapist, a private OT, a private speech therapist. He used to call them his ladies. He had about 7 people that interacted with him in the course of a week around his autism and support for that. So we have many families, and many of them have multiple kids with special needs, and all of those other resources disappeared. They kept asking us, why won't our in-home supports come back? And we obviously said, we engaged with OCFS on those conversations, but Respite was able to keep going and to continue to provide services throughout. As part of that, we heard a lot from families asking for more help, which is how we were able to get OCFS to increase the hours from 16 to 26 hours a month. And we continue to provide respite now at the 26-hour a month level, and continue to see more families and providers recognizing that this service is still available, and families who don't have other supports reaching in for that support, because they can pick their own provider. So if your neighbor is really good with your kids, you can actually hire your neighbor, provided they pass all the appropriate background checks, So it wasn't about strangers coming into their house or people they didn't know where they'd been. So that felt more safe to a lot of families. As part of providing respite in the very large, it's a statewide program, so it's in every county. We work with the Maine Association of Family Organizations, and the Maine Parent Federation and the Autism Society of Maine are two of our partners. And they did a survey to the families that they are also connected to. And they asked them, what was the #1 concern your family is facing at this time? And are there things your family needs? Only 8% of the families there were over about 150 respondents, only 8% said they had no concerns. 42% related to homeschooling, with 61% of those households saying they were significantly concerned that their children were going to regress during this time. And that 23% needed more guidance and help from schools about how to teach their kids. Really, regression, challenging behavior, and loss of social skills and mental health were the themes that those parents expressed, as well as 1 in 4 of them said they had not been contacted at all by their case manager or their in-home support. So that was 1 in 4 of the folks who responded. These were families raising kids with special needs, so they hadn't heard at all from their provider during this time. So NAMI Maine's additional impact in terms of reaching out was the teen text line, which hopefully all of you have heard of. We, in the beginning of April, recognized that 14 to 20-year-olds who may have never been connected to mental health supports, or those who had been, were just struggling with the incredible amount of anxiety and disappointment that they were experiencing. So we started, with the help from MIHAF, started a teen text line, which continues and will continue actually as part of the state's response. They've written us into their FEMA money to continue the text line. It's staffed by college age individuals who identify as peers. And it's a support and resource and referral line. And I can give you examples should anyone want one, but so that we continue to do. And it is a texting platform, which means that there's the ability for a licensed clinical social worker to just watch over it to guide youth if they're struggling at all. We do right away let them know that we need to contact crisis if they share concerns that they might hurt themselves or someone else. We've only once had to loop in crisis, and that was done very successfully. Most of them are just really sad and disappointed kids with unbelievably high levels of anxiety and nowhere to go with that. Our staff have helped a bunch of young people, the 16 to 18-year-olds, figure out how do they gain access to a counselor. Or NAMI had over 40 licensed providers offer to donate their time to do clinical mental health check-ins. So we're able to offer that to both the teens who text as well as folks who call our general helpline, folks who hadn't ever been connected to mental health services but felt they were really struggling. So that's sort of our kids' land, which we just know there's the level of anxiety their brains are experiencing right now is not something that'll just go away when COVID goes away. I mean, the impact on the wiring and functioning of their brains. And the other side, and I did include this in what I sent out, the other issue I wanted to talk about is, I think the most of you know that NAMI Maine coordinates the implementation of the Crisis Intervention Team program. I really want to stress it's a program. It was started in 1984 after a Black man with mental illness was shot and killed by the Memphis Police Department. It was started as a community policing model. It was brought to Maine in 2002 by Melissa Gatteen in the Portland Police Department. And so with that, we have 53 police departments who are participating in CIT. It's a community policing model where law enforcement, mental health, families, and people with mental illness come together to talk about how law enforcement is responding to people with mental illness in their community. Only 7 of the 16 county sheriffs have signed on, so the majority are municipal police departments that are participating in CIT. So you can see, I put in this, but I'll read some of them, that the departments are saying, so we surveyed them. Actually, we surveyed them starting yesterday because the Department of Education had asked us for some data about what we were seeing. So, the departments are reporting an increased level of acuity when they respond. At least 3 different suicide deaths included notes where the individuals who died by suicide made it clear that the lack of resources available to them made them feel hopeless. And that was in 3 different parts of the state. They have reported seeing people over and over again because there's no other resources available. to them. And so they call 911 because that's who shows up always. Their departments were reporting call volumes was increasing, while crisis services reporting that they anticipated influx but hadn't experienced it. Their departments were reporting that their only ability was to transport to hospitals when someone was in crisis, because the crisis workers were not coming out into the field. And on one occasion, a department had to bring an individual to the hospital twice within an hour's time because a thorough assessment had not occurred the first time they brought the individual into the hospital. 2 different departments experienced 3 suicidal deaths within a 2-week cluster during the height of the lockdown. So that suggests to us that our suicide rate is increasing. We know that it takes a while for that data to officially come out from the CDC. Departments also report an increase in overdose deaths and responding multiple times to the same location for family conflicts, especially those where children were lacking resources, back to my previous population of kids who need additional support that weren't getting it. I also think one department, a larger municipal department, and I shared this specifically too, had 47 mental health welfare check calls. 9 were the same individual calling for request of service or transfer to the ED. 3 were calls for parents calling for their juvenile child and seeking assistance. 27 calls were requests by mental health providers requesting that police complete a welfare check or transport to the emergency department. And crisis did not respond. So our mobile crisis system did not respond in any of those cases. And 2 individuals were from a PNMI program, and 2 were ACT teams requesting checks. So this means by removing the individual who called 9 times, 56% of the calls to law enforcement for mental health and welfare calls were from mental health providers. So we obviously are really concerned that we want, I think, as part of the mental health workforce that the senator chaired in the fall, we all had consensus that we all want a mobile crisis system that responds like first responders. When I was a child welfare worker, I used to investigate child sexual abuse in Lewiston, Auburn as my first professional job. If I was going to remove a child from the custody of their parents and I was concerned about my own safety, I could bring an officer with me, but I couldn't send an officer instead of me. And we very much are concerned that our crisis mental health system is sending officers instead of responding. And we do, I'm sure it's not a surprise, we get a regular influx of calls and letters from people who are in our county jails who are struggling with mental illness, and calls from their families. We do our best to advocate for them in terms of access to mental health care, but there's no standards in our jail, so that's a pretty significant challenge. But so I think that, speaking specifically to COVID, I hope that I have addressed what topics you would hope to hear from NAMI Maine.
Thank you very much, Jenna. Appreciate it. Next, we have Monique Stairs, who is going to be speaking from the perspective of SUFU, which is Speaking Up for Us, Maine.
Great, thank you very much for having me today, Senator Breen, Representative Gatine. I did send along some my testimony, so I'm gonna skip a couple sections of it due to time. But I really just wanna highlight that the last several months have been very unprecedented here in Maine due to the COVID-19 pandemic. And it has especially affected people who live with intellectual and developmental disabilities. In the middle of March, it was actually March 13th, SUFU immediately shifted our business model to provide a response and support system to self-advocates who are connected to our organization across Maine. We started offering twice weekly phone calls over video conferencing as a means to hear their concerns, their experience, and share information. We moved all of our in-person chapter meetings that were happening to Zoom meetings, and we also began participating in national self-advocacy calls with people across the country to learn about how COVID-19 has been affecting all Americans who are people living with intellectual and developmental disabilities. And so during this pandemic, we've participated in a lot of different advocacy and identified several systemic issues. And I just want to highlight some of those today for you. There have been obvious increased healthcare disparities among people with intellectual disabilities. And a lot of these concerns were addressed by the Office of Civil Rights regarding both the access to respirators if needed, if they become ill, and their right to be able to bring a support person with them to assist with communication and support needs during any medical treatment. And most of those were, and that is regardless of what the hospital visitation policy might be. Congregate group home settings have increasingly become hotspots for COVID-19 outbreaks. Several self-advocates who are active in SUFU have been exposed and tested positive. Self-advocates have shared concern of being kept inside their group homes and forced to move to a quarantine home if they choose to go out in the community. For example, one gentleman had to miss out on a family birthday party because he returned to his group home, and he would have had to quarantine again in order to be able to even go back to his home that he lives in. And that is regardless of whether he was able to use proper social distancing. So that opportunity was no longer available to him. Meanwhile, their support staff are coming and going and bringing the virus back to them in the home. People with disabilities are being denied access to the community. There are also growing concerns over rights violations and lack of PPE available for the advocates to investigate. And I think that Kim Moody really spoke about that, but we are also seeing that. Also, many facility-based day programs closed completely in response to COVID-19. This left many people with disabilities with no services. This also included case management services were cut back, and shared living provider services in some areas were cut back, so people had no contact for quite a period of time. This caused a gap of support for many of our SUFU members so that they could receive communication and support that they need every day. In many cases, SUFU staff stepped in and provided support over Zoom. We did a lot of increased phone calls, a lot of messaging and emailing with people. Some providers were able to adapt and begin using technology to provide supports, while others remain closed and only recently began reopening. And the self-advocates saw that as we were hosting statewide meetings and hearing about how some of their peers were able to continue to get the services that they need, while others were not because of where they live and what service agency they receive services from. ODES did work to issue guidelines for reopening facility-based day programs. They did hear concerns from us around that. And we worked closely with them to help give some feedback about the risk-benefit guide that they put out. People with intellectual disabilities have had pressure to return to day programs, even though the risk to their health may be greater than the need for their parents or their shared living providers or others that really want to get back to normalcy. COVID-19 has certainly been an opportunity to identify many systemic issues within the current service model. And we also agree that there's areas for improvement. And many self-advocates had mixed feelings about returning to day programs and have been using that risk-benefit guide to make those decisions. We've also seen a lack of disability representation, and that was a real concern for self-advocates around COVID-19 decision-making. This has been including representation on the reopening task force, and especially we were concerned because of the known cases in group homes in Maine. Self-advocates are also concerned about the lack of information and what they can do to protect themselves from exposure from their support staff. And how they themselves can access adequate PPE. Financial hardships are typically a real issue for self-advocates, for people living with disabilities, and also not really knowing where or how they could access PPE if they wanted to. And access to technology has been an issue for self-advocates to remain connected. More community support programs could have continued. They could have provided telehealth services to more people if there were access to devices, internet connections, and then also training on how to use those programs like Zoom and Skype. SUFU worked hard to assist many of the self-advocates who attend our regular meetings to stay connected. The Maine Developmental Disabilities Council was able to purchase and distribute 148 tablets to people with disabilities. That benefits some of our members directly, but still that's only 148 tablets. There were over 500 people who applied. So the need is definitely there. And then through the emergency K waiver, it was explained that there was money made available for technology, but the issue was that many of their case managers who would normally help them be able to apply for that or access that weren't aware of the option, or they weren't currently working because they had been laid off. And so many of our folks who asked about it were not able to also receive means to get technology. And communication about how to obtain and use technology is definitely needed here in Maine. I also just want to share with you that most recently, one of SUFU's strongest self-advocates was diagnosed with COVID-19 because he was exposed through his support staff. That self-advocate felt backlash for speaking up about practices that were happening in the home that were against the CDC guidelines. And if this is happening in this home, it's likely happening in other homes. And that is a really concerning issue. And I think that that really backs up some of what Kim was saying around needing to be able to get out and be able to see people face to face. So we would like to ask the legislature to consider some of the following in making decisions. Getting further input directly from people living with disabilities and or their families in future decision-making regarding the pandemic. SUFU would also strongly feel that access to proper PPE for disability rights advocates would be beneficial, as well as for people living with directly with disabilities. Self-advocates themselves also need that access. And we also just want to highlight that there is still a continued need for the wait list, the wait for services to be addressed. I've been in contact with one family here in Fort Fairfield who also testified on the waitlist bill that was heard earlier this year. They're still waiting for services. So all of those folks that were waiting, the pandemic has definitely affected their lives as well. And finally, I would just also mention that many DSPs have been working tirelessly and working really hard to try to continue to support the people that they work with. And they've been placing their own health and that of their families at risk by continuing to go in and out of homes and possibly exploring hazard pay for those DSPs. And I would just like to share with you a couple quotes at the end here directly from self-advocates. Marco, who's a self-advocate from Brewer, has stated that no one should be made to feel like they are expendable in a situation like this. Historically, people with disabilities have been left to fend for themselves in a time of emergency. People with disabilities should be more of a priority and less of an option to society. And Hope, a self-advocate who was really affected by this, this pandemic because she stopped receiving any services, shared with us that we are more than what other people can ever see of us. And we will continue to advocate for the rights of people with disabilities. And I thank you for your time today and the opportunity to be able to bring up these concerns.
Thank you so much, Monique. Really, really appreciate it. The last presenter we have, thank you so much for hanging in there, Simone, is representing the Consumer Council of Maine, and it's Simone Mallon. Thank you very, very much.
Thanks, Senator Breen and Representative Gatine and members of Appropriations and Financial Affairs for inviting me to share with you. As Senator Breen said, I'm Simone Mallon. I'm the Executive Director of the Consumer Council. I'm also a person who lives with both mental health and substance use recovery and challenges. And first, I want to say that there are many systemic issues that exist in Maine that have just been frozen in time. So all the things that we've been working on at the legislature and with the department, all of those things are frozen, unfortunately, because there are many issues that still are unaddressed and concerning. Of course, having come behind Monique and Jenna and Kim, who have eloquently, as they always do, spoke of those. I want to echo those things are still, there are many concerns still in place. The crisis system still is a major issue. I hope we take away from this worldwide experience the absolute need to be looking at trauma-informed services and care for people. We sort of lost our way in many respects in regards to trauma, and I want to make sure that I hope with our, universal experience of this pandemic that we not relearn, but relook at the need to understand trauma better, because it has been so impacted by all of us. And then you talk about the mental health community, which already has, the majority of people have significant trauma issues. And this is just another significant layer of trauma on top of trauma. So I would be remiss in saying that. The mental health community, if you don't know, the research is already before the pandemic, is likely to die 25 years sooner than the general population. So when we talk about healthcare disparities, the mental health community is greatly affected. And that's from comorbid conditions like diabetes, which is often medication related, and other health conditions, asthma, you name it. And so folks in the mental health community are at high risk, as are folks that are in the intellectual and developmental disability community. So we at the council continue to operate. We're still in operation. Actually, we're back in the office. We've been here since June 1st back, but we moved to a Zoom and conference call platform. We have continued to meet with our local councils, and we did forums around the state via Zoom and conference call all through the month of May, and have been hearing a lot from the consumer community. There are less people in the mental health community in congregate settings, but there are a good amount of them. And we share the concern with congregate settings and staff not having PPE, not following CDC guidelines, people not being allowed to get out to essential appointments or services that they are needing. We have worked a lot with the mental health community around understanding how to use Zoom and technology. I think, I'm a person that has to find the silver linings in things. And so one of the things that I really have seen is people who never in a million years would have used Zoom or learned technology are being forced to in order to, connect to their communities. And that it's had side benefits. People can go to church on Zoom and do the other things that are important for their recovery. But the reality is, if you're living on disability on $700, $800 a month, you cannot afford internet service, cell phone service, often a government phone with limited capacity for calls, let alone any data. Access to, it was nice to hear that the DD Council did some grants for stuff, getting technology out to people. Because I will tell you, I just quickly yesterday, I posted on Facebook into a peer group around the state of Maine, and people clearly said, we absolutely need access to technology. And there's no way that we can afford it when we're living on a fixed income and living in poverty. So universal Wi-Fi, broadband access, I know those are big issues to fix, but they are the reality for folks who do not have the means to gain it. And with that comes lack of access to telehealth. I think telehealth is an amazing option for our community, but you have to have technology to be able to access telehealth. And so we're seeing a wide variety of things out in the community, from service providers completely not connecting with folks at all, folks who are getting services via phone, when clearly if you listen to Maine Care, telehealth should be video first. So your first option should always be a video chat, because you can learn so much more from a video chat than you can from a phone call. What we're hearing from a lot of folks that do have some access to telehealth is that they often are just getting phone calls and not video capacity. So I don't know if it's a lack of technology on the provider side, a lack of training. I don't know exactly what the issue is, but it continues to exist, and it is a challenge for a lot of folks that even do have access to technology and not being given that opportunity to see people via video telehealth versus phone. I want to say some things that are going well. People have talked about clubhouses. Now, clubhouses are a billable service, and they are not the same as peer recovery centers. Just want to make that clear. Clubhouses have been working hard to do Zoom, Skype, and Facebook Lives with members, and people have said that that has been really helpful. One of the other things that's been going really well is the Office of Behavioral Health has temporarily increased funding to the Intentional Warm Line, which is a peer support alternative to crisis. And that service has been expanded. It normally only has 2 people on during the day and evening and 1 person on overnight to handle the entire state. And they now have current capacity with 3 staff to answer a lot more calls. And I'm hoping, if I've got an ask, my ask is that the Warm Line funding, I think the Warm Line has been not as recognized as it could be for the amount of work that they're doing. And I hope that we think about them as a vital piece of the continuum of crisis services as we move forward. I know they were able to expand with FEMA money through the Office of Behavioral Health, and that's set to expire at the end of September. I think I'm going to stop and breathe. And I think that's what I don't want to keep going, because many of the folks who have said things so eloquently have said them. I also included it with my written comments. A fellow peer who did want to come, because when I talked to Senator Breen, we asked about hearing from some peers, and my fellow peer, Lydia Richard, who lives in Milo, would love to have come here and given you her words herself, but her computer has died, so she is without a Zoom capacity. So she actually typed out her words for me, and I printed them and sent them along for all of you. She lives in Milo, and she's been pretty isolated as well. So I think things are all over the place. There are some places that are doing things well, and I would say the majority are struggling and in the middle or not at all. Thank you for your time.
Thank you, Simone, very, very much. And thank you for making available the remarks from someone who otherwise would have been here. So before we conclude, I wanted to open up to the Appropriations Committee if you have any questions for the panelists on consumer experiences. Representative Gattin.
Yeah, again, I just want to say a couple things. Again, very appreciative of the information. Definitely a lot of things that I hadn't thought about or considered, so that was helpful. Again, on the other hand, I made a comment earlier in the meeting in another section that so many of these problems and challenges are very predictable and definitely represent, a lack of attention and resources. And I hope that one of the lessons learned coming out of this is just how much better prepared we need to be with respect to certain people. Certainly not a surprise that children with special ed needs, would face very specific challenges that are above and beyond the amazing challenge or the terrible challenges that parents and students and teachers are facing otherwise. So again, this is very thoughtful information, and I really want to thank you all for being here today to present it to us.
Any
Well,
other
thank you.
committee members who want to chime in? Okay, thank you all very, very much. I think it's really important to hear from folks who are working in vulnerable systems to begin with, and then we see what happens when you layer a crisis onto a vulnerable system. So, as Representative Gattin said, we have a lot of opportunity to do better here. So thank you very much. We're going to move on to the ending part of our agenda. And I appreciate so much the committee members here hanging in with us. It's been a very, very information-packed afternoon, and very grateful for your time and attention. The last topic we want to discuss is sort of how we're going to move forward as a committee and working with the governor. And Commissioner Figueroa, I believe, has joined us. Welcome, Commissioner. I just want to briefly summarize. Representative Gattin and I were able to get on the governor's schedule yesterday, and I just wanted to give a brief update. And sort of the gist of that was because she has made public statements in the recent past about wanting appropriations members to be involved and the committee to be involved in deciding how the CARES Act 1.25 billion COVID relief funds will be distributed. And as we've heard from the DAFS commissioner in recent meetings, some of those decisions have already been made. And of course, we know that the governor has the legal authority to do that. But we did have a productive conversation yesterday talking about a role for our committee and coming to an agreement that some of that money should be going out into the community. Some more, I should say, because as Commissioner Figueroa has reminded us, importantly, that some of it already has gone out to community groups and to folks who are on the front lines with COVID-19. In addition, we've committed $260 million to the Unemployment Trust Fund to replenish it for the end of this month. That's a really important investment in the business community. And that's something that we are not alone in doing. Probably about half the states in the country are doing that as well, so that we can get people the unemployment relief that they need and not have to increase employers' payments in the future to refill that trust fund. So some of the things that came up in the meeting yesterday were, priorities and how we prioritize the funding that we might be interested in allocating, and how we work with the administration to develop a proposal that our committee can really agree on in a bipartisan way and get to agreement with the governor's office as well. And of course, this is the reason we've been having all these informational sessions all these weeks. So Representative Gattin, did you have any further comments you want to make about yesterday's meeting before I turn over?
No, Senator, I think you summarized it really well. It was a productive meeting, and it was an important step. And my sense, coming out of that meeting, was that the governor is very interested in working with AFA with respect to deciding the further allocations of the CARES Act money.
Yeah, and I think that there's also wide agreement that 1.25 billion sounds like a lot on paper, but the need is great, and we will not be able to fulfill all the needs that are out there with this extra funding. And, you know, there still could be more coming from Washington, D.C. I understand that the Senate is reconvening in July, and everybody's hopeful that there'll be a fourth package of coronavirus relief funding. And we certainly share, I think, the administration's preference that at least some of the federal money be available to replace the anticipated loss in revenues that we see coming not only in FY21, which starts tomorrow, but in the following biennium as well, in FY22 and 23. Commissioners, is there anything you wanted to add in the wake of yesterday's meeting about suggestions on how we proceed together? I think you're on mute.
Am I now?
We can hear you now.
Thank you. It's very nice to see you all. No, I think you did a nice job of summarizing. I think I would just like to say that I think that's always been the message. And the reason that I continue to highlight all of the pieces of information that we continue to gather is because I think we've been thinking about appropriations as kind of the funnel to understand everything and be able to kind of collect the information and then be able to talk with us what we're hearing. And that's why, right, we've been bringing up the information that we still have to come. The Economic Recovery Committee should be developing a report shortly for the governor. If not, I know it's July 15th, I think is their kind of deadline, but I do think they're working a little bit earlier. That will provide some information, as well as Senator Breen just mentioned, there's more conversation about what might happen on July 15th or ish in Congress, particularly around the fact that the $600, which impacts a lot of low income workers who, you know, in Maine are working in hospitality. And I feel like we're getting signs from people that they are definitely going to do something about that, if nothing else. And of course, we have CEFC that has come in and revenue forecasting who will be coming in, and we look forward to having all those conversations. We are putting together another round of information for our congressional delegation, and we'll share those updates. I think we mentioned originally as part of that letter, can't remember, it was in the end of May, I think, where we sent that, we had attached a spreadsheet that had some dollar amounts, and as time has gone on, we've been able to either add more or refine some of those dollars. You heard in particular today from the Department of Education and the higher eds, so we will update those numbers. It just goes to show what we've said, which is the need is great, and 1.25 billion goes quicker than people might think. So thank you for being our funnel.
That's one of the nicer things I've ever been called. Thank you so much. Representative Hubble, you serve on the Economic Recovery Commission, and I know that I have to own up to a little confusion about what is coming forth, I think maybe later this week or early next week. Would you mind clarifying that for me and others?
Yes, thank you, Madam Chair. Yeah, it's been an accelerated schedule, and I think, like all of the rest of us, the committee is feeling a sense of urgency about not just relaying a set of recommendations that can be put in place directly, but also communicating, I think, what they're feeling is the most important priorities. So the subgroups last week all sort of tendered their recommendations to the full committee, and it's my understanding that the chairs hope to put something on the governor's desk about their quick start recommendations by the end of this week, which comes a day early because of the holiday, so Thursday. There's still the July 15th deadline for a different set of priorities, which I think will then tie into the longer term plan for December's report from the committee. So there's really three products: quick start recommendations, which I think are becoming fairly clear, should be ready for the governor, as I understand it, by the end of this week. A set of recommendations to stabilize and support the economy on July 15th, and then longer term plan to reconnect to the state's 10-year economic plan and grow the economy for December.
Thank you for that clarification. So it'll be interesting to see what the quick start recommendations are and if there's some overlap with what we've been hearing over these last weeks through our meetings. Senator Hamper has been watching, I believe, quietly. Just want to check in, see if he has any questions from his caucus or comments before we wrap up. Not hearing any from, oh, he says he's quiet. Okay. I can appreciate that. Well, thank you all again for your time and attention today. Hopefully our discussions about the specifics of how we develop a plan for some dispersal of the money will be forthcoming. We'll have some more conversations with the governor's office, certainly in the near future. And any other questions, concerns, Mr. Chair, before we wrap up, or from any committee members?
Want to tell the commissioner I appreciate her joining us here on the last day of what has been probably one of the most unusual fiscal years in the history of the state of Maine.
Happy New Year.
I bet you'll be happy to turn the page on this one, and hope that we can start making some progress in the next one. Thank you, Commissioner, for everything you've been doing.
Thank you. Thank you.
Representative Millett has his hand up.
Thank you, Madam Chair. Just like to react to your updates and Commissioner Figueroa's as well. I think these last 4 meetings where the committee is gathered together personally and remotely to gather information has been helpful in seeing the extent to which the COVID virus and the shutdown of the economy and the impact on all sectors of the economy and people included has been so difficult for all of us. And I remember a conversation that I think Commissioner Figueroa was in on with the governor's chief of staff and the chairs and leads, where a bifurcation of the damage to maybe separate external, meaning the economy, from the internal, meaning the general fund, highway fund budget issues was advanced. And I found that interesting because until today, we had been hearing mostly from the external economy, hearing today from the education sector and just being blown away by the magnitude of the numbers that were being talked about and the uncertainty of where our education systems from kindergarten to graduate school are going to go in September. Gives me a sense that I'd like to be more than just a listening committee of 13 and have no authority or responsibility and no accountability for putting things back on a more permanently affordable and prioritized course for the short and long term. Leads me to wonder, is our role just to be listeners and let somebody else do all the heavy lifting? Or do we and our other 173 counterparts who are duly elected legislators have a voice in this process as well. It feels to me like for the last probably close to 8 weeks now with chairs and leads conversations and other meetings, I feel like I've been treading water, not knowing where I'm going to go, with July 29th being circled on my calendar as a date when I'm looking to or anticipating a major disruption in the current biennial budget, which will require the, in normal terms, rebalancing the internal part of our funding obligation. So I guess I'm willing to take the step of suggestion that maybe it's time maybe that the minority party also had a conversation with the governor. And we continue to do that in our regular caucuses, where I can just tell you all that Republicans want to get back together on the third floor and do something and make the future clearer for all of us, not just the administration. And yet we are really zeroed in on the COVID-related problems that we've been listening to and talking about. And in the midst of my last few days, I received a message that one of the presiding officers has instructed you folks, and I'm not sure how formal that instruction was, to start looking at all of the bills on the appropriations table and start prioritizing those that could be important, well outside of the COVID world that we're dealing with. And it caused me to think, well, maybe we really don't have a role here to resolve the COVID problem. Maybe we're more a party that's going to be chastised by the electorate because we couldn't do anything. We couldn't get anything done. We deferred everything to the administration and in a wide open special session to the majority party. I didn't sign up for that minor role of being a whipping post for inactivity and or partisan negligence. And I'm anxious to get some guidance and some understanding of where we as a committee and where we who care are likely to play a role in the next month and a half. And I'm not hearing it. So I'm just going to stop now and say, I'm sounding like the same message I give every time we gather. I don't know what the heck I'm doing here. And it's no fun just being talked to. So let the message go out that this knucklehead would like to be involved in some serious work. The reason I talked about former Chair Rosen and former DAS Commissioner Lowe. They've been commissioners of DAS, as I have. They've built budgets, they've balanced budgets over many, many bienniums. And here we are sitting like maybe this Economic Recovery Committee, which I've been told on more than one occasion was a long-term committee, is going to have a role on the 15th of July that is going to be played out by people that have not, in a large part, dealt with building and balancing budgets. Make that a point of frustration, I guess. Thank you for listening.
Well, this is not original, but I hear the message and I thank the messenger and I share some of those frustrations. Representative Keschel?
Yes, can you hear me?
Yes, I can. Thank you.
Yeah, I would agree with Representative Millett, and I'm getting questions, as I'm sure all of us are, about what are you going to do? How are you going to help us out? From businesses all across the spectrum. They're looking for action, and I understand, and I've been patient, and I understand that there's a need out there to get information together and all of that. But I think it's time to move forward and be active as a committee in whatever role we can play to get the money out there to the people that most need it. I certainly know that I feel their pain, and every time I go into certain places, I hear the concerns, and whatever we can do, we need to do it. Otherwise, I just I don't see how we're going to be active participants if we don't get together and work this out on together, so to speak.
Thank you, Representative Cashel. Representative Gattin?
Yeah, thank you. Again, I don't, well, I'll put it a different way. I agree with a lot of what Representative Cashel just said. I think that what we do need to make sure that this money gets used to its best use. The purpose of these meetings that we've had over the last few weeks is to do what I think is the important due diligence of hearing from people as to what the situation is on the ground. I think this committee is more than willing to put in the hard work. We are not in a world where, we can be up here all the time right now and have, open mic public hearings. So, my co-chair and I have done our best to try to craft agendas that get this committee the information that it needs. I do think that the governor has the legal authority to do a lot of the disbursement when it comes to these COVID funds. Obviously, what we need to do to bring the budget into balance is something we're not going to know until we get the revenue forecast at the end of the month. Those are in some respects, I guess there could be some relationship between those two things, but really those are two separate issues, especially because the federal administration in Washington has told us that we can't use any of that COVID money in order to bring our budget back into balance. I think the purpose of these meetings has been to put us in the position where we can develop a plan for the use of the money, working with the administration. I agree with some of the sentiments that Representative Millett spoke to, but I'll also say that, we have had conversations among ourselves, and, the invitation has been out there of let's work on a plan together, the Republicans and the Democrats on the committee. And I still think that that is the approach that we should take. So if what I'm hearing from the Republicans on the committee is that they're willing to work with us on that plan, I welcome that opportunity. And I think this is, I have a lot of confidence in the ability of this committee. I think we've proven our ability. We have delivered unanimous supplemental budgets. We did tremendous work last year on the biennial budget. I think this committee has the ability to do the hard work and to make the tough decisions and to work together. And I think we're going to be called upon to be doing that over the next month and later in the summer, depending on whether or not we come back into session. So I think these meetings have been a good use of our time. There could be differing opinions on that. But I think until we're in a position where we've heard from the people on the ground about what the situation is, this is a limited amount of money that probably could be spent 4 times over, before all the unmet needs were made, before the unmet needs were met. Again, I'm looking forward to us working together on this.
I think that one of the things I heard, and I'm sure Commissioner Figueroa would agree, is that the governor is interested in a bipartisan proposal. That's a stronger proposal, that's, I think, the right way. That's how this committee always operates. So, Representative Martin, are you trying to chime in? You're on mute, so nod your head.
I'll mute myself here for a moment. But I do agree that there are many legislators who are talking about what are we going to do. But the other thing to keep in mind as we come in to get to a point of having a session, we have all the work in some of those committees that they've not finished their work. And somehow that has to happen. And so in order for us to finish work at Appropriations Committee and get whatever is going to move forward off the appropriations table, we need to have that done. And so somehow I think that leadership has to deal with that issue. And I think we need to move in some direction. But I do think the Appropriations Committee can put together a package and then get that to the governor's, well, through the legislature and then to the governor's desk. And the last word I heard is that they were talking possibly having the legislature come back in August. So whatever that should be, whatever the deadline is going to be, I think between that today and that time, appropriation needs work to do.
Thank you. Representative Cashel, is there something?
Yeah, just some final thoughts, and I appreciate certainly the willingness to work together. I want to work together. We've worked together over many years. I've been on the committee, but you know, it's good to hear from all of these other constituents out there that I may not hear from, but I'm hearing from the ground, so to speak. I'm hearing from constituents that are being basically, many of them are closing up shop or can't open, and they don't know how they're going to hang on until the situation gets to a point where they can open. And, you know, as far as coming back, I'm really interested in providing COVID-19 related issues and to work our budget out around the COVID-19 issues. I mean, there's a lot of important issues we're facing in the state of Maine. There's a lot of issues on that table that people should probably get funded, but we're facing a crisis now, at least as I understand it, and it's a crisis that is sapping our revenue stream, and it's a crisis that somehow we have to focus on without getting other issues aside from the COVID-19 issue involved in political debates. And that's where I'm at. I'm more than willing to come back and work with anyone on this issue. I know that our constituents, all our constituents, need support in many areas, and certainly the ones that we've heard from need support. But we really should focus on COVID-19 issues, at least from my perspective, when and if we come back.
I just want to add one thing. If you've not had an opportunity, I believe it's Time Magazine, who just put a package together of what happened during 1918 and how that period and what took place that period. And it's amazing how some of those things are similar to what's going on right now. So I think that maybe we're not rewriting history.
Well, thank you all again for your thoughtful comments, for your participation, for your hard work. Very grateful. And I think we will finish up for tonight, and we'll be in touch again soon. And if you're leaving the building, drive safely. If you're already home, go have a drink. Thank you all.
Thank you.
Bye-bye.
Thank you. Bye, everyone. Happy 4th.